Orange Medical Practice, Karen speaking.
Are we talking cancer?
Well, sometimes it can be a sign of cancer.
Yeah.
Before I was a very calm person, and recently, when I go on my social media, I see something, it just gets to me, I just get angry.
Is that you?
Yeah.
Blimey. I'll never look like that.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I know.
There we are. Okie doke.
It's a good job I've got no kids meeting.
Morning, Ebony.
Morning.
I nearly died this morning, Rihanna. I was running, and there was these 3 sheep that I'd managed to get out of the field onto the dirt path. And then I was like, oh, God, fine, just move out of the way, I'll just walk past you. So I ran. And then they charged at me.
Because I thought you were coming after them.
Well, it wasn't. I was just running innocently. I was listening to TLC.
What were you listening to?
The Creep.
Come in. Hi, love. Here you come. Hello. Take a seat, ladies. So, hello, Hardia. My name's Debbie. I'm a nurse practitioner. What can I do for you?
My leg hurts or my kneecap over here.
Right.
It all started since last evening.
Right.
She can't bend it properly or straighten it up.
OK. And then when she woke up this morning, she came downstairs still?
Yeah, but
Right.
but she can't straighten it up.
No, I can see
Yeah,
she's limping,
yeah,
isn't she?
Yeah.
That's quite
Do
an
it properly.
important point, because usually with children, if it's something and nothing, it would have gone by the morning. What did you do yesterday?
I just was playing and I did some work and I don't know how it started.
You point to where it hurts for me. There. OK, now we need to have a look at it, and I'm just going to take your temperature. What year are you in?
Year 2.
That's a big grown-up year, isn't it?
Yeah.
Right, what I want you to do is I want you to take your shoes off and I want you to take your tights off. You're lovely, aren't you? Eh? Take your coat off as well, because it's... Right, come and walk on this floor. Walk over to me. Oh, darling, does it really, really hurt?
It hurts a bit.
Right, can you try and put your foot down? Does that hurt more?
It's just when I'm going to put my leg straight, it starts hurting.
Come in.
Hi, Dr. Beatty.
Hello. Come in.
Assalamualaikum. Oh, yeah.
Come in. Come
Okay,
in.
thank you.
Come in.
Thank you.
Let me help you to the chair.
Okay, thank you.
So
Thank you.
just to your right, another step.
Thank you.
There we go.
Thank you.
Nice to see you again.
Nice to see you, thank you. I think I've got a fissure or a similar kind of problem,
Right.
a hemorrhoid.
Yeah.
But basically, it's been going on and off for the last 2 or 3 years,
Right.
and it's really, really uncomfortable.
Sure.
We've tried the gamut of ointments, quite a
Right.
number of things, and it's not shifting.
Yeah.
So I was wondering if we could try something drastic.
What were you thinking?
Could you try an injection, do you think?
Is there any bleeding?
Well, that's a tricky question, being visually
Because you
impaired.
can't see it, can you? No. Have you ever seen a specialist about them?
No, I've had a CT scan and stuff done.
Right, OK. What was that for?
I think just because I was experiencing a lot of bowel problems.
At the moment, when you're pooing,
Yeah.
then, does it really hurt?
Sometimes it does, but certainly afterwards, there's quite a lasting stinging and
Sure.
itchiness, and
Sure. Sure.
it's really awful.
Yeah, no, of course. Now, I know you've been examined recently.
Yeah.
It'd be good if we had another
No, that's
look.
fine. That's absolutely fine.
Is that okay with you?
Yeah, no, absolutely fine.
Okay, all right. Let's pop you on the couch.
Okay.
So, I was going to come get you. I was going to come get you. So,
Okay.
the couch, can you feel
Yep,
it
got
there?
it. Thank you.
That's the foot of the couch.
That's fine. Okay.
Let me just draw this around. And while you're there, just let me get some gloves.
Yep.
Oh, wow, you're already on the bed. You're like lightning quick.
Well, no time to waste.
You see, because you've seen so many specialists, you know the exact position,
Oh,
your
well.
knees up, it's all done, isn't it? You're some kind of expert patient. So, OK, that's good. On the outside, I can't see any lump. Yeah, there is a little bit of a...
Pustule.
Yeah, oh, well, no, it's just a little bit of bowel.
Yeah.
There's no abscess there or anything like that. Let's get you decent.
That's fine. Thank you.
So it does look like it's continuing irritation
Yeah.
like before. Have you been getting things over the counter?
I've been tried stuff like, Sudocrem.
I don't think Sudocrem's going to cut it.
Something needs to cut it, I tell you. Thank you.
There we go.
Thank you.
Good lad. OK, so why don't we try a kind of general cream
Right.
for the moment? Also, something that's got a little bit of steroid in it,
Yeah.
as well as some local anaesthetic.
Okay.
And then if it's not helping, what I would be thinking is something targeting specifically
Right.
the possibility of a fissure.
Right.
Is that all right? So that's the prescription.
Thank you.
There we
Thank you
go.
very much.
Good.
Thank
Do you
you
want to ask me
very
anything else?
That's it, I think.
No? Lottery numbers? No?
Well, I'm sure if you knew that, you wouldn't be here, would you?
Are you ready? First, I'll start at your feet. No pain there? No. Does that hurt?
If it's hurting...
Just say, darling, I want you to say, because
No, it doesn't.
I'm just going to move your hips. Does that hurt?
No.
This knee is a little bit swollen
Yeah,
here.
it is,
It is
it
a bit
is.
swollen here. Up you get. There's a good girl. Put curtains round you and then you can put your tights back on. I know you're not going to like this, Mum, but I would say we are very, very careful with children's joints. So I think she needs to go up to A&E for them to have a look at her.
Oh, no.
Because swelling and pain in a joint when there is no fall, in children, often it's just their body responding to a virus or something like that, but we can't scan, X-ray, examine, but they do that up in A&E.
Yeah.
Is that
thank you.
okay?
Yeah,
Put
that
proper
would be
tights
great, yeah.
on the... You're a mystery, aren't you?
Yeah, I was wondering as well, how could this happen? Because all the time she was in home. I mean, she didn't go outside, even for cycling.
Yeah. Do you like your bike? Do you ride it without stabilisers? Good girl. That's great, isn't it? What colour is it?
Pink.
Right, so all the best, my love. Get to the bottom of it. See you later, ladies. Bye-bye.
Bye.
Hiya.
My blood test level at 5 to 10.
What name, please?
Kelly, K-double-O-Y.
Brought the sunshine out with you.
Certainly did. And you're looking dapper with the
Oh,
sunshine as well.
thank you.
Yeah, it all blends in together, doesn't it, for both of us, look there. Made your day, love, that.
You have, yeah, absolutely.
Hey, another thing, you're sweet as a nut as well.
Thank you.
Come and take a seat, because we chatted on the phone, didn't we? You've been having some difficulty with this pessary, haven't you?
Yeah, she has a pessary. There was a bit of blood loss, wasn't there, Mum?
I'm losing blood all the time, really.
Yeah. How long's that been going on for? Was it just when it was changed, or was that happening before it was changed?
It was happening before.
Yeah.
Yeah.
Is it sore?
I feel sore, yeah.
So what I wanted to do was have a look and see if we can work out why you're bleeding, because sometimes pessaries can rub a bit inside and they can cause a bit of discomfort.
Right.
But the other thing is we need to just have a look inside to make sure there's nothing else that might be causing the bleeding that might warrant a referral to hospital. So shall we have a look and see?
Yeah, you can, yeah.
Yeah. Right. So let's just get you up here. OK, you all right there? Let me pull this round. So, I'm going to put a hand on your tummy first. They're cold, though, on my hands, I'm afraid.
Not to worry.
OK, so I just need you to relax these knees, OK? I think I'm going to take this pessary out today.
Okay.
So that I can have a look and so that we can give you a bit of a break inside, all right?
Thank you.
Right, let's just have a little look. You all right?
Yeah.
OK. There we go. You OK there?
Yeah.
Yeah, there is quite a lot of blood in there, isn't there? It's difficult to see exactly. Yeah, right then.
You all right, Mum?
Yeah, fine.
Come here, love.
Right, so looking inside, there is quite a bit of red blood actually. It's not easy to see any obvious place where it's coming from or any obvious cause for it. I think it's most likely that it's that pessary that's caused irritation inside.
Oh, good.
But I can't be certain, and I think the best thing to do will be to ask the gynaecologist up at hospital to see you soon.
Right.
OK? Because sometimes bleeding after the age of the menopause can be due to other things.
Right.
Problems in the womb or problems in the vagina. I can't see anything there, but, you know, it might be deeper inside.
Yeah, OK.
Sometimes it can be a symptom of cancer, so that's why I want the hospital to see you.
OK.
Yeah? And see you soon. Get it over and done with. Yeah?
OK.
Let's get your trousers.
Okay.
There we go.
Oh, you're lovely. Thank you very much.
That's all right. So,
Thank you.
my job now is to write to the hospital and
Right.
see if they'll see you. Like I say, it'll probably be within a couple of weeks, but I think it gets it over and done with, doesn't it?
Yeah. Are we talking cancer?
Well, sometimes when you have bleeding after the age of the menopause, it can be a sign of cancer.
Yeah.
So I think it's better to be safe than sorry and go be seen up at the hospital.
OK.
Yeah. I'm going to give you some cream as well, though, in the meantime. There we go. OK? All
Thank
right,
you very
Mama.
much. Thank you very much.
OK,
You've been
you
lovely.
take care.
Thank you.
Thanks for coming in. Thank you
Thanks
for bringing
ever so
your mum in.
much.
We'll get the door. There you go.
Right, thank you.
OK.
It's cancer.
Mum, she didn't say it's cancer. She said it could well be the cause of the pessary. It's been left in 3
Yeah.
months over.
Or it could be cancer.
Yeah, so you've just
know.
got to...
I know, Linda.
You've
I
just
know.
got to wait and see.
I've got these 2 students with me today.
Oh, yeah.
OK, fire away, ladies. So how can we help you today?
So I'm just going to lift up. And if the student just has a feeler. So if you just...
Jaundice people, I always thought, how can you tell if someone's jaundiced? And
Yeah.
then someone came in, I thought, right, I can,
That's
I can
jaundice,
see.
exactly like Simpsons.
Yeah.
If you just flick that like that, just gently. Feels like a guitar string.
If you feel mine, I've got 2 good ones there and there.
Oh, yeah.
Yeah, so that's what you're feeling for, essentially.
Good job. OK, well done.
I really enjoyed it, actually. It was satisfying as the first one, yeah.
Cheers to the 2 of you.
I'll drink to that as well. Cheers. Hello.
Morning.
Hello, Mrs. Attar. Come in. Right, come and sit down. Hello. Right, Smee, do you want to come and sit down as well?
OK.
So do you mind if Smee tells me a little bit about why... Thank you for speaking to our students, by the way.
it's fine, yeah.
Great, thanks.
Okay, so this is Miss Actor. She's come in with a 2-3 week history of hot pain, starting in the elbow. She's tried using some ibuprofen gel, some painkillers, that made no difference. With the pain, it's probably more so on the lateral side.
Yeah.
She's got Surgeon syndrome, and she was told that sometimes she gets some rheumatism as a side effect. I was thinking that possibly it could be more so rheumatoid.
So, you mentioned rheumatism because she mentioned Sjögren's syndrome. Any other
I think
ideas?
it could be a trapped nerve as well.
Could it also be golfer's elbow?
Yeah.
Tennis elbow.
Tennis elbow,
Yeah,
that's
right. OK, so now we're on the right
Yeah.
lines.
Yeah.
OK, because she's got tenderness.
Tennis?
No idea. So, the other name for tennis elbow is lateral epicondylitis. Yeah. OK. It is so important that students come to GP surgeries on placements to learn what they see here, the interaction between patients and their doctors, the conversations that we have with families can't be taught in classrooms or from textbooks. So seeing that firsthand, there's no substitute for it, really. So what might she be doing on a daily basis that could cause this?
Helping the daughter.
Yeah.
It's all your fault.
Oh, look at that face.
I work in a school. I help children with disabilities. I help them a lot. And obviously this one, she needs help as well. So,
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushed in the wheelchair. She helped a lot.
Does she? So now we think you've got a condition called tennis elbow or lateral epicondylitis. Now we've got the diagnosis, we need to come up with what we can do to help. So she's tried ibuprofen gel, she's tried ibuprofen tablets, and they are certainly options.
Steroid injection.
Right, now we're talking, because that will give you probably the quickest relief, really.
I would prefer something quicker, yeah.
Do you want it now?
I don't mind it. If it helps, because it's got to a point where it's just annoying.
Yeah. Right, let me draw it up.
So what do you think? Marks out of 10?
Yeah, come on, Khadija. How did they do? Not me. I'm 10. Go on. What are we going to give Eleanor, first of all?
9.5.
9.5. That's not bad, is it?
That's a good score.
What about Samit?
Same.
9.5. Oh, I think
you always got to leave a little bit for the challenge.
Yeah, I like that. That was good.
Right, sharp scratch. And with tennis elbow, you want to try and cover as much of it as possible. And I would just fan a little bit out. Timmy, just press that down for me, so we're all done. How was that?
It's all right.
10 out of 10?
Yeah.
What do we reckon, Khadija? Come on. Throw me a bone. 10 out of 10.
She's always having a bone.
Hello. Are we all right?
You're a bit tan. I agree.
Do you think?
Yeah.
I'm still Menorca tan. In the summer holidays, they made me do this CCG video about the sun safety with children called Slip, Slop, Slap, about putting on sun cream. And there was me, like, really tanned. I'm so not the right person to do this. Really.
That's so funny. Hi, I'm Dr Tatham.
Hello.
Hello. Right.
Oh, this has been going on for so long now.
Right.
And it's just basically, I started last year in May with a problem in the top half of my back, in between my shoulder blades, when I sort of try and like bend over a tiny little bit and breathe in. It's really sharp pain. So I tried everything. I've been for acupuncture, I've paid for physio, I've paid for sports massages, I've paid for a chiropractor, I've tried naproxen, I've tried tramadol. Nothing was even masking it. It's the neck pain. That is something that I've had ongoing for probably about the last 10 years of my life. It's like a really like hot, like intense, sharp pain down my arm. What I get around here is a hot, stabbing, dull, constant, like aching pain.
Right. What's your main worry about all this?
That it's not going to go away. It's yeah. Go
Show
on,
me if you want.
Doctor.
As long as it's accurate. A bit like Brad
Well,
Pitt.
you've got a strange growth coming out the top of your head at the minute, so I can't say that's particularly accurate. It gets me down.
Okay.
It makes me ratty with my kids.
Has this stopped you doing anything in particular?
It stopped me doing like upper body exercises now. I can't do like lateral pull
So you've
downs
changed what you do.
or shoulder raises. I can't do anything.
Yeah.
This is what my back did look like.
Oh, yeah?
3 years ago.
Is that you?
Yeah.
Blimey.
I'll never look like that.
I can tell you that for nothing. I want to have a look at your back.
Yeah.
So I'll just go and get a chaperone, all right?
Yeah, okay.
2 seconds.
Yeah.
Right, then. Right, this is Adi. So, you just take that top off on
Yeah.
and we'll have a good look at stuff. Right, can you just point out to me where you're feeling that pain now?
It's just all there.
In there, right. Right, can you twist round to the right? Oh, it's stiff. And twist round to the left. Right, push that wall over for me. Don't actually, I'll end up in trouble, but pretend. Does that seem to aggravate any of your symptoms? It does?
Yeah.
Right, OK. Follow me, so go out to the side with your arms, and if you get any pain anywhere, just tell me where it is.
You know. All
There.
down there, yeah.
Right. Pop your top on, thank you. OK, so what I think this is it's the muscles between your shoulder blades that aren't quite right. So if you want a proposal from me, it would be that I get you some NHS physio and...
I've done all the muscle building stuff like that before, so I know how to strengthen the muscles in my back.
I know,
so I
but
just
it's
think,
slightly
you know,
different.
I know, but
It's
I
slightly
don't know.
different.
I just feel like I think I have had physio for this. If you look back on my record, like 10 years ago, there's some. I just feel like I'm just going through the motions with it. I feel like
I understand
Do you know
that.
what I wanted to get today? I wanted you to come and refer me for an MRI scan.
A lot of people do.
Yeah.
And I understand why people want the scan and feel as that's going to give us the answers. But from what you've told me today, I really don't think it's going to further our journey whatsoever.
An MRI scan would show us when something is broken or misaligned in the back. In most cases of back pain, that's not the case, and the pain results from the way we use our back or misuse our back. And so an MRI scan wouldn't demonstrate to us anything having gone wrong, and therefore is often very unhelpful.
I would be amazed if hospital physio sorts this out, because it's been, like I say, it's been
I will tell you now,
in the
6
making.
sessions of hospital physio isn't going to sort this out, OK? But it's going to take some months of you doing it to really notice the difference.
OK.
I've got a lot of sympathy for patients who come to us with an idea about what treatment that they should have. But as gatekeepers to the NHS, we really do have to keep a handle on what we refer patients for.
What I'm going to do is leave you with an open appointment to come back, and then we can talk about what the next step, which may be imaging, but we'll talk about that then.
All right.
Right, OK. Can I keep that for my notice board? No, that's very good of you, thank you. Nice to meet you.
My hair is so short.
Short?
Yeah.
It's long. My hair's short.
But look, like, it's just short.
Hi there, I'm Linda Eves. How can I help?
I've been getting really bad migraine headaches all this side, and I can't like lift my head up.
So is it like a throbbing kind of a headache?
Yeah, like I can't drive my car.
Okay.
I can't get up.
Yeah.
Like my eyes are burning. I feel very, very tired, lazy, moody.
It certainly sounds like a migraine.
Yeah.
Have you had migraines before?
No.
Okay.
No.
When did you last have your eyes checked?
It's been a couple of years ago.
All right.
Yeah. I think I need to book a
X-rays. I was going to say. Would you say anything seems to make it worse?
It's just like general stress, like, I don't know. Like, my family's saying to me that you might have bipolar because I'm moody all the time.
Okay.
Like, normally I'm a completely different person.
Let's just check your blood pressure if that's all right. Have you ever felt that you might hurt yourself in any way or not?
No.
We have to ask these questions when people talk about their mood. Your blood pressure's fine, OK? It's just, I'd like you to tell me a little bit more about your mood.
I just, like, feel really, really moody.
Crying a lot?
Yeah, crying a lot. Being, like, my own world for some reason. Like, you know, like, small thing I make it big issues, like, in my head.
Yeah.
Before, I was a very calm person. And recently, even I'm on the phone to my friends, I've been just, like, flipping, shouting at them. I just get too scared as well.
Scared?
I don't know, I don't want to go through depression or bipolar and stuff. I just want to be a normal person.
She's scared now, honest. I'm always scared now. Any pain I get, I'm like, I hope it's not sepsis, I hope it doesn't come back.
You nervous?
No, not too bad.
Yeah?
Do they numb me first?
You'll be okay. I'm here to hold your hand and to talk nonsense to you in your ear.
Grief, I hate this. Okay, so just a sharp scratch.
Oh, you okay? You're being really brave, I know you.
I just can't stand it, honestly, I'm not joking, I just can't. No, my life has gone this way.
How are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Are you? Why?
It's your neck, isn't it?
It'll be all right.
I'm not gonna lie, I'm nervous.
You're nervous.
I'm
Don't
nervous,
be nervous.
scared.
Oh, don't be scared.
Have a seat. I'm Dr Tatham. So...
There's only 2 ones that I really want removed, and he said you're only going to be able to do 1 though. But the other one is literally on my leg, and I've caught it and it started bleeding.
Right.
That's the only reason I wanted that one off.
We'll have a look and we'll see what's what.
Right, OK, so you lay back. Right, OK.
I've been dreading this all day. Oh, we're going to actually ring up this morning and cancel it, but my mum shouted at me, so I didn't.
OK.
Don't worry.
She had a bite go at me.
Are you OK?
Yeah.
Right, where am I looking?
It's just sort of like on my right bum cheek kind of thing.
And where's the other one?
That's just there. That one catches on my clothes, but it goes up like a little dried up Rice Krispie. So I've started wearing high-waisted pants now so that it doesn't catch on it.
Well, they're fashionable, aren't they? Are they fashionable?
So,
yes,
yeah,
they are.
very fashionable.
Right, so...
You are going to numb it though, aren't you? I'm not going to feel anything.
Yeah.
That's not your needle.
Oh, my goodness.
Yeah.
No, you get the small
Yeah.
one.
Not that mean.
I want to that then I can't look at the same needle.
You okay? Don't worry.
Right, roll over onto your side towards Karen, if you don't mind. It's a right awkward place, isn't it? There we are. Okie doke.
You okay there?
Oh!
It will sting. It will
Right.
sting.
Oh, no, that's hurting. Oh.
OK, so if we take a little look at these questions, OK, how often have you felt down, depressed or hopeless?
All the time,
Okay.
honestly.
Do you ever feel bad about yourself or like you're a failure or you've let your family down?
I feel down about myself,
Do you?
yeah.
How often have you had any trouble concentrating on things like reading the newspaper or watching television?
Yeah, I don't like watching TV.
OK.
It just gives me depression more. I don't see things, even like when I go on my social media, I see something, it just gets to me, I just get angry.
This just sort of gives us a baseline score so that as you get help and treatment, whether that's talking therapies with medication, we'll be able to see hopefully some progress over the next few weeks when we look at the same questions again. The best treatment for people who are experiencing low mood is some talking therapies. How do you feel about that?
Can I not get any medication that like lifts my mood up?
Is that what you were hoping for? Is that what you were
Yeah,
expecting?
I need something that makes me better. I want to feel normal, like other people feel normal.
We could try you on a low dose of medication, but I just want to emphasise the fact that it is good to have talking therapies alongside that. Let's settle this migraine down first.
Okay,
that
that's
should sort
fine.
that out. And then let's start on a low dose of something called sertraline. Is that OK? And then we'll be in touch in a couple of weeks
that's fine,
and see
then.
how things are going. All right? We'll try that number or that number for counselling, or you can come in and see this lady. Now, for some people with this medicine, they do feel a little bit worse in the first few days. Hopefully not a lot worse, OK? But it's not a quick fix.
OK, thank you so much. Bye.
Bye-bye.
Bye.
All right. It's a bit sensitive around there. Can I squeeze my hand?
Oh, she's good
Told
at
my
holding
mum she
hands,
should have
it's
come with
Ken.
me.
Oh, no, it's my role. What are you normally doing on a Monday?
I would have normally been at work.
Right.
Okie doke. So, let's sort this one on your waist, shall we? Perfect. So
Right.
this will sting.
Well done. Well done.
I don't know how I can moan about this. I've had tattoos. They hurt a lot more.
Right, here you go.
Okay. Can you feel anything?
It's just a little, like, tugging.
Oh, you feel tugging, yeah.
Yeah.
Nothing sharp.
Okay. Gone.
There you go, not too bad, eh?
Okay.
Okie doke.
Right, last one.
Last one.
Well done, well done. Well done. It'll ease in a minute, literally seconds.
There you are. Worst bit.
It's a good job I've got no kids being in it because I don't know how to get through time.
You do it.
Oh.
Right.
There you go.
Is it done?
Yeah.
That was the least painful.
That's good. Save the best for
That
last.
one I've got right sweat on.
Have you?
What did you do this weekend?
Went to Aberystwyth.
Where's that?
It's in Wales.
You went to Wales?
Yeah, I went on Friday, came back Saturday. Megan...
Came back Saturday?
Yeah, I went to a uni open day with our Megs on Saturday.
Uni?
Yeah.
In Wales?
Yeah. She looked at Banger already, and this is the other one.
She's looked at what? Banger?
Banger.
Banger? Banger and Aberystwyth. Am I saying it right?
Aberystwyth.
Aberystwyth.
How can I help?
I've got a leg infection, right leg.
Okay.
I've got 2 lots of antibiotics and it's still not cured.
How have you got this infection then?
I walked into a road sign.
Okay.
Well, not a road sign, a street sign. Everybody else puts them on a wall. Not a great Yarmouth in Norfolk. They pull them out about a foot away from towards the edge. Bright sunny day, I moved over to let somebody pass me on this side. Straight into it. Bang.
Have you had any temperatures at all or anything like that? You don't feel unwell in yourself? No. And do you feel your leg is red or hot or anything like that?
It is still warm.
Yeah.
Check this off. I've got my toenail actually now.
And where did you knock yourself in the...
Well, it scabs are, just go in.
Just pop your leg down for me, please.
Ow.
And is this what your leg normally looks like?
No.
It looks more red to you?
It's more red to me. It is on the night. It really flared up and it burns.
Well, it doesn't feel warm the way you were saying.
So big, back of there. Yeah. That's normal.
Are you not feeling breathless or anything like that? You're not feeling short of breath or anything?
No.
Okay, well, there's a lot of water.
It's fluid, isn't it, on that?
Yeah. So I'm just going to give you some tablets for that.
What tablets?
Yeah.
Yeah, my wife's had them. She's feeling good in the toilet. Cheer up, might never happen.
So I'm not going to start you on any antibiotics, okay? You've had 2 weeks.
2 lots, yeah.
It's going to mess up with your bowels.
Yeah.
It doesn't look too bad to me there, okay? Keep an eye on it. Try to keep your legs elevated. You're not allergic to anything, are you?
On an ex-wife. Best thing I've ever done. We're still friends, and that's as far as it goes.
That's good, isn't it? So you know what you're doing, yeah?
Yeah.
So I want you to keep an eye on the leg, okay? If you think it's getting worse, you need to come back and I'll have another look. See you later.
Right, thank you.
Bye.
Open wide, Henna. Stick your tongue out, say ah. You're never really off duty in the medical profession. Staff ask you questions from the girls in reception, admin, and you're always sort of watching out and about.
If there's somebody in the public who might need your assistance, you will do what you can to help them.
It's a 24-hour job.
There was one time that I was waiting for my luggage in an airport and a lady collapsed. She wasn't breathing. There was a defibrillator nearby. After 3 shocks, she did regain consciousness, which was amazing.
So I think the most exciting out of hours incident we've had was the birth of our son, Henry. You delivering Henry.
Daddy was midwife at
Henry
home.
came.
I was trekking in Nepal and one of the ladies in front of me tripped and fell and broke her arm. I managed to get a plank of wood and padded it with newspaper, and we used some scarves to wrap around it, and then she was able to walk back to the road to get to the hospital in time.
I'm here.
She wanted Krista.
Give us a shout.
Yeah, if you feel poorly, let us know. There was one time at the gym where a man was talking about a rash in his groin and suddenly just pulled down his pants right there in front of everyone.
Give it another week. If you get worse, seek doctor. All right, my darling. Drink plenty.
Hello, hi. What can I do for you?
I found a lump under my arm. I say it's the size of a pea.
Mm-hmm.
It doesn't hurt, but it's definitely a sore feeling.
You've not noticed any discharge from there?
No, well, it's not like a spot or anything. Finished, I felt the lump. I thought, well, you automatically think about it. You know, cancer, anything like that. So I thought, well, I'll get it checked out by you guys. The only reason I'm really concerned about that is because my dad died of cancer. So whether it's in your genes or if it's, hereditary, I'm not sure. But I thought I'd get that checked out.
Okay. And what kind of cancer your dad had?
It basically was riddled with it. It was everywhere.
Come in. Good morning.
Good morning, love.
Take a seat, love. Is it Beryl?
It is, love. Back where, love?
All right, my love.
Right, OK. And you wanted to book another appointment, did you, my love?
Any time, any day, love.
I think you'd benefit from some steroids today. What do you think?
You all right, love?
You're right.
All right, love.
Deep breaths, my love. And out.
Hello.
Hiya, love. You OK?
Yeah.
Yeah.
It's all right, carry on. I feel so sorry for you, love.
It's one of them days, love. Don't worry about it.
All right,
right then, my love.
Thank
you. Bye, Amy.
Come on, Bubba.
See you later.
Ta-ra, love.
In you come, my love. I'm Debbie. So this is baby Dylan. He's 9 weeks old.
Yeah.
And your mum.
Yeah, I am, yeah.
And today Dylan's come for his 8-week baby check. Have you got any more children?
Yeah, I've got 4 at home.
4 more old?
Yeah.
Wow, so he's your 5th?
Yeah, he's my last.
Your 5th and your last, definitely. Well, we'll talk
Trying
about
for a
that.
girl, but all boys.
Have you got 5 boys?
Yeah.
Fantastic. And there is some very rare syndrome that touches your family a little bit.
Yeah, I've not seen any.
But you've not seen... Has
No,
any of your
I've
other children got it?
My eldest and the one just before him.
Right,
yeah.
so it's called Waardenburg syndrome. Yeah.
It mostly affects the hearing.
The hearing, yeah, and
but
some
he passed
pigment.
his flying colours.
He's passed his with flying colours. So you know all about that and you're happy with it? Right, my love, so I want you to take all his clothes off, leave his nappy on.
Hello, chunky monkey.
Hello. Hello, darling. I'm your Auntie Debbie. I'm going to turn my light off now and look inside his eyes.
Sometimes he goes a bit boss-eyed. Is that normal?
Babies, you in the first couple of months often go boss-eyed.
Oh, OK.
He's looked fine today. Keep your eye on it for 3 or 4 weeks. If you see it again, we want him to come back.
OK, then, no problems.
Just going to listen to his heart. What are we doing to you? Oh, yeah. Right, so his heart sounds are completely normal. He's breathing beautifully. Just check his testicles.
Yeah.
One there, look. One there. He's got both of them down already. So if you dress him, but leave his legs out.
Yeah.
And then I'll get his injections ready
Yeah, no
while you do
problem.
it.
Hey, you're a nice guy.
Well, until your oldest child got this syndrome, did you know anything about it, or was it?
My mum's got it, yeah. My mum's fully deaf.
All right.
Yes.
Did she sign or did she lip read?
We all sign in the family.
Yeah.
Her mum's deaf, her dad's deaf.
Right.
I'm partially deaf in
Oh,
this
you
ear, yeah.
Pop him on your knee when he's ready, my love.
Coming in you.
No need to rush, though. So, the first thing he's going to have is drops in his mouth, and the drops protect him against a virus called rotavirus.
Yeah.
They taste nice.
Oh, OK, that's good.
Rotavirus is a very nasty diarrhea and vomiting bug. Now, then, you'll like these because they're like sweeties for babies. A big bruiser like you should love these. There you go, aren't you clever?
He won't turn anything that goes in his mouth down.
That's what we like, though. Big strong babies, there's not like them, is there? So if you put your hands around his middle, I'll deal with his legs. It's going to scream like mad.
Yeah,
His legs are going to bleed. You're ready, aren't you? You're a sensible lady. 1, 2. First one done.
I know, baby. Oh, bless him.
All done, darling. There you go. All done. I'll have that in a minute when it's out. There you go. Get that done. What did the nasty woman do to you? There you go. There you go.
Oh, darling. Oh, bless him.
Where do you feel the lump?
There. Just put your finger right there. Feel it.
Because I'm rubbing off my finger on it, isn't it?
Yeah, it's only so it only hurts slightly if you push on it.
Yeah. It's a tiny, small lump, isn't it?
Yeah.
Yeah. Okay. I'm just gonna feel your armpit if you don't mind. Okay. Okay. Can I see the other side as well?
Yeah.
Okay, that's fine. And should we? Yeah, you can put on your shirt. About the lump.
Yeah.
So this lump, I know you said you were worried about cancer.
Yeah.
It doesn't look like a type of lump that we would see with cancer. It's something we call folliculitis. What it means is that we do have hair on our body in different regions.
Oh, yeah.
When one of the hair somehow falls and infection gets entry into the root of the hair, that causes a bit of swelling. That's what it is.
Oh, okay.
So it's nothing but the blockage of the hair root.
Yeah.
We don't need to do anything specific to treat it. It gets better at time.
Yeah.
And most of the time, it resolves within a week or 2 weeks' time.
All right.
Just examine it after a week. It probably would have gone.
All right, brilliant. Cheers.
Thanks a lot.
Thank you.
Thank you.
talking to an 80-year-old this morning. She says, doctor's asked me to book a telephone call. All right, okay. Tell me which day is best for you. And she goes on, this is what I do this and I do. And I go to the gym on a Tuesday. I went, what?
Well, my granddad's nearly 90 and goes to the gym 6 days a week.
She says I'm 80. And I've been going every week for the last 25 years. I thought, oh, you girl.
gosh.
Yeah. I've got to go and join her myself.
Mr. Robinson.
Yes.
Come in. Right then.
Yeah.
How are you?
Well, not so bad apart from my leg. The trouble is, you put it
Yeah.
during the day, but I do stumble a bit with it. But it's at night in bed, that's where it's worst.
Yeah.
You know, you get interrupted sleep.
So where exactly do you get this pain then?
Here. It's here mostly, but same as I come this morning, it's going down my leg. Yeah.
Should we have a look at you?
Yeah.
You take your jacket off.
Yeah.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, 70 years, gosh. Oh, you must miss her.
I do.
Yeah. Do you think that keeps you awake a bit at night as well?
Pardon?
Does that keep you awake a bit at night too, or...?
It's getting up to sleep, you start thinking.
Yeah, yeah. Have you got family nearby?
Yes, yeah.
Can I untuck you?
Yeah.
I do think you look incredible for your age.
Yeah.
You're 93 now?
Yeah.
What's your secret?
Yeah, a pint now and again.
Good lad. Right then. Do you get out and do much walking?
Not a lot.
Do you get out the house at all much?
Yeah.
Yeah?
Yeah.
You got friends nearby? Good.
Yeah, yes.
Can you feel that?
Yeah. Just downside here.
More that side, yeah?
Yeah.
Just put your leg back down. So you feel it when I press?
There, yeah.
Yeah.
There.
Yeah, so it's right on the outside of your thighs here,
yeah,
isn't it?
yeah.
It does definitely seem more pain in the hip, doesn't
Yeah,
it,
yeah.
that's causing this.
Yeah.
So I think best thing is to try and keep as active as you can. So a
Yeah.
little bit of walking will help. Do you think when you're out and about it might help to have a stick? Have you got a stick?
Yeah, I have one.
Yeah, just so you can catch
Yeah,
yourself and just... What we don't want is for you to fall over, do we?
no.
Yeah. So there's this issue of the pain at night. Do you think it might help if I give you something that might help you sleep but might help a bit of nerve sort of pain? I'm thinking of a tablet called amitriptyline that might help you sleep. Should we give it a go?
Yes, if I can put my glasses on.
Oh, yeah, forgot about them. Good job you remembered, didn't it?
Thank you.
There we are. OK. So, I'll give you a ring in 2 weeks, OK? Any problems,
Thank you.
just let us know.
Right, thank you.
Give that a go and see how we get on.
Yeah, thank you.
But I think it's probably that hip, you know.
Yeah.
You've probably got a bit of wear and tear in it, haven't you?
Yeah.
It's had 93 years of use, hasn't it, eh?
All wear and tear.
You take care of yourself, all right? Bye-bye.
Thank you very much. Right, lovely to see you. And thanks for sharing that with us as well. See you later.
Sorry, boy.
Not at all, not at all. Nice to see you again. I hope I don't
then.
see you, obviously, for a long time, but
Yeah,
well
so do
soon. All right then.
Bye-bye. Say yeah, hold your jumper. Bye-bye. He's lovely.
See you later.
See ya. Have a nice time.
Good morning, the Ridge Medical Practice. Vicky speaking.
So you stuck your finger in a coffee grinder or something?
Yeah, but do you know, I was so calm. Everybody was really shocked with me, yeah.
So can you count backwards now?
5 before.
Yeah, then before that?
3. 1.
Okay.
Right, that's the worst bit over. Now you can sit back and think about plutonium, is that real? Isn't that just from Superman?
Kryptonite.
Kryptonite.
Krypton's real.
Can I have a good feel? Is that right?
And she's all there, and you can hear, not being awful, and hear.
You've had bladder cancer, you've got no bladder, you've had a massive polyp removed from your bowel, you've had meningitis, you've had heart attacks. Let me tell you something, your diabetes is perfect. Oh my God, Karen, guess what I had in my bathroom again today? Another giant spider.
And Mia, they're not going to hurt you because it's cold out.
I like spiders from afar. It's like I like tigers, but I wouldn't want a tiger in my bathroom.
Ooh.
Hi, I'm Linda Eves. How can I help?
I've just started last couple of weeks with having quite severe dizzy spells.
Mm-hmm.
If I'm rotating my head, I get quite dizzy.
Okay.
Yeah, it's just causing me some issues.
Yeah. It sounds a lot like benign positional paroxysmal vertigo. Have you heard of that, BPPV?
No.
Okay.
No,
it's
it's a good one.
Thing,
Yeah, well done. Yeah.
Classically, it's sort of rotational movements of the head. It can be looking up or down or turning your head to one side, and it tends to then set off this sensation of spinning or turning or unease. Is your general health good at the moment?
I've just done the Yorkshire Marathon, so
okay. Well,
I got around there okay, so I think I'm okay.
You're okay. Let's check your blood pressure. It's fine, no problems with that. 122/80.
Yeah.
Just tilt that slightly that way. Mm-hmm. Great. Okay, well, there's nothing in the ear canal that's causing any increased symptoms, and there's no signs of infection or anything. So if you're happy for me to go ahead, I can do what's called the Epley manoeuvre. So in the semicircular canals in your inner ear that are responsible for how you orientate and so on, they can get some little tiny crystals that form in there, which when they move over some little hairs with fluid, they create a sense of imbalance.
Okay.
And so the repositioning techniques help that.
Okay.
Right. Ready?
Yeah, ready.
Okay, down you go. Okay, keep going, head over the edge, right down to the back. How do you feel?
Yeah, it's just wobbling a little bit.
Sit yourself back up. Have you noticed at home or whatever, if there's one... Okay, that's worse, isn't it?
That did it, yeah.
That did it.
Morning, Katie. I'm Debbie. I'm a nurse practitioner. Who's this lovely lady?
Mummy.
Your mum. All right. And I've got Andrew here who's learning to be a doctor and he's just watching us today. Is that OK? Right. What can I do for you?
Since, probably Friday time, she's had this rash on her cheeks. All up her arms, all on the legs.
She's not been poorly?
No.
Not poorly?
But she was really hot this morning.
Right.
She's had some paracetamol and she seems OK.
Right, so this is the thermometer and I'm just going to check your temperature now. Is this rash itchy?
She had been scratching it a little bit on her face, but not that itchy, is it?
No, it's a funny little rash, that rash on your face, isn't it? It's a little bit blotchy.
Yeah.
Have you got a sore throat or anything?
No.
Can you do a big wide mouth for me? Say ah, stick your tongue out. Say ah. No cough, nothing at all. No. Can I have a look at your belly?
That seemed all right. Just like her arms and legs. It's gone a bit down on her arms now.
You can see there, can't you? Was it, when it were bad, were it raised?
No.
No, just like this. Every rash we get, I mean, I can tell to look at, she's not poorly, but we do the, where you talk about the glass test, we just pull it like that and you can see that this rash goes completely. Well, you're a mystery, aren't you?
You are.
That's part of your charm, isn't it? There's a little bit on this on her face that looks like a thing called urticaria, which is just a rash that people get, and often they're a response to a virus. We don't treat it, we just say, see how you go, and you can take some antihistamine if you need it. She's well, and that's the main thing. It's coming and going, because it's gone, you know, from her arm, so I think it will settle. It might take a couple of weeks, all in all, but bring her back if it gets worse. Bring her back if she's got any other new symptoms.
Back to school tomorrow, then.
Back to school tomorrow. But today, you've got our permission to lay on the sofa, get a telly on, get your feet up, and let your mum run after you a little bit. Is that all right? I love your glasses. You look so brainy in them. Are you brainy?
You are.
You are, I can
look
tell.
clever clogs.
Okie doke. All right then.
Lovely,
All the
thank you.
best. OK, don't any worries, you know, just bring her back if it gets worse. See you later then, chick.
Hi.
Have you ever had your hair cut?
She had it cut quite short, about up
So
there,
long.
and then she decided she wanted to grow it again,
Oh,
so...
it's beautiful, isn't it?
Yeah.
Let's have a look. I'll be touching your bottom next time we see you.
Oh, that's what she's hoping for.
See you later, love.
See you later.
See ya.
Are you ready? OK. So lie yourself back. OK. Right over here. How do you feel?
Yeah, that's doing it.
That's doing
Yeah,
it. OK.
yeah.
Turn over this way. Tell me if it sets it off.
Yeah.
Yeah. Oh.
yeah, right. And it's normal again now.
OK. Keep turning your head a bit further over. That's good. Stay in that position. Turn your head a bit further forward. That's perfect. Are we OK like that?
Yeah, I'm good, yeah.
You're good. Bring your knees forward, so what you're going to end up sitting forward facing my desk. OK, how are you doing?
Yeah, I'm pivoting side to side rather than going...
OK.
Rather than it being dizzy. That's it, it's settled down now.
Settle down.
Yeah.
That's quite quick. We'll get you back over in the chair.
Yeah.
You all right?
Yeah, good.
OK, up you get then. Just... OK, keep looking there. Round over here. And sit down. OK. You can't drive when you've got symptoms of vertigo, so looking over your head and so on. Hopefully, with this repositioning now, things will be quite a bit better.
I think I'm at that age where I'm collecting things now. So it's, yeah, the eyesight went last year, the ears went 2 years before, so it's just waiting for the next thing.
How you doing?
Hi.
Not bad.
I like your waistcoat.
Pulls my tummy in.
Oh, yeah, can I have one?
I use it as a corset, if I'm honest. When I get home, I go...
That's very nice.
They contacted me upstairs because they said you were really poorly and needed to be seen urgently.
I've been in hospital for 9 days. I just come home yesterday. But what it is, I can't keep knocked down and I'm in agony.
OK, let's go back a bit. So tell me about what happened. Ended you up
Basically,
in
when I
hospital.
went in hospital, I got up that morning in bad agony like I usually get. And then I started vomiting up like brown stuff and blood, pure like red currant blood. I hadn't been at the toilet for like 10 days.
OK.
And he thinks that I've functional dyspepsia with my stomach, but they want do some tests to check the nerve endings. Because also they were worried it might be gastroparalysis.
Yeah.
But I've just been in really bad pain and I can't keep knocked down.
Don't worry, we'll be able to help with all that today. I just want to make sure that you understand what all those terms mean.
I know they explained a little bit that if it is gastroparalysis, it's basically where your stomach becomes paralysed because of the nerve endings.
Yeah. You are right with gastroparesis, where it means that the stomach isn't moving things out of it down into the gut very well, and that can lead to food being there for a while, which in turn leads to more acid to try and digest that food. And dyspepsia is just a posh word really for acid production, over-acid production that can come up your food pipe and cause all sorts of pain and problems there. Do you mind if I have a feel of your tummy today?
Yeah.
Is that OK? You're able to come up on the couch. Who's looking after the children while you're in hospital?
My partner.
OK. How are the kids?
All right, you just missed me.
Oh, I bet. Right, I'm just going to lift all this up. So just bear with me, my hands are a bit cold.
OK.
You're very sore, aren't you? Is this how sore you've been all week?
I've been like this for 9 days.
I'm just going to have a listen into your bowels, OK? When was the last time you had anything to eat or drink?
Yesterday.
And you said you haven't opened your bowels for how long now?
10 days.
10 days. Do you feel like you need to go and open your bowels?
I just feel like there's a lot of pressure there, like I do need to go, but I just can't go.
When they did the camera test up your back passage, did they tell you that you might be constipated or anything?
You could see there were a lot of poo there.
Was there? OK.
Yeah.
OK. Come off there and we'll have a think about things.
Well, it's basically, I come today to see if we can get a bit of anti-sickness off you because I can't keep knocked down.
I think that's fair enough.
And I'm losing a lot of weight. It's like when I was in there, I lost £2 from the Saturday to the Saturday, and then in past 6-7 weeks, I've lost over 1.5 stone as well on top of that.
OK.
So they're really worried it's going like to a dangerous weight.
Severely underweight.
I just feel weak.
Yeah. What we'll do today, get you on some anti-sickness medication. I know you're on the pantoprazole already, I want you to stay on that, but I'm going to give you something else to help form a coating over the lining of your stomach. I'm just a bit worried that if you don't open your bowels in the next 2 or 3 days, we might need to think about giving you an enema to try and move
I've had
it.
enemas up there, and neither of them worked.
Well, what I'll do, just to try and get things moving a little bit, is give you some little suppositories that you can use yourself morning and evening time. Does that sound all right if we do those 3 things? Anti-sickness, something for a coating on your tummy, and then something to help.
Yeah, they're the little bullet ones, aren't they?
They are, yeah. They're not very pleasant, but they'll help.
It'll help, yeah. Oh, it's better than having what I've got right now.
Yeah, I know. You look like you're struggling there.
I am. I'm in pain. I've got no energy or nothing.
Oh. Well, why don't I arrange to see you in about 2 weeks' time?
Yeah.
And we can weigh you, see how your pain is, and make sure your weight isn't dropping any further.
Yeah,
I'll send you
brilliant.
that appointment out so you don't need to worry about that.
Yeah,
All
thank
right.
you.
OK,
Doctor.
my pleasure. Now, I believe you've got something on your finger to show us.
Oh, I have. Does anybody put a finger on how to feel of your prostate?
And like there, it's like the skin peels off. It's like it's burning.
I just can't put my finger on why his blood sugars have gone up.
Oh, come on, Hannah.
Stop it.
He's going for it,
He just runs to bite.
Can you just follow my finger with your eyes?
Well, work sent me on because, you know, it's too dangerous. I've already lost a finger, you know, in the machine.
So he chopped his finger in the car bonnet.
All right, I'll speak to you then. Fingers crossed.
I was just reading about your finger. How are you?
I'm all right with myself.
So, is it painful?
No, not really, no. It's not painful. Only if, like, I accidentally hit it off or something, then it really hurts, but...
And can you bend your finger okay? Yeah. Yes?
Yeah.
So, is it just the top?
Yeah, it's just the top end. They've given me...
Did you have surgery?
No. I didn't go ahead with it because they said to me I could either have the surgery or not, just let it heal. So I just said there's no point doing it.
Sure.
They've given me this dressing.
Now, are both those dressings on now?
Yeah.
My goodness, you must have gotten a shock.
Yeah, but do you know, I was so calm. Everybody was really shocked with me,
You were the calm one?
I was really calm, yeah. Everybody else was, like, flapping everything. But I was really calm.
So what kind of surgery would they have done?
Basically, they would have cut it down, cut my bone down, cut it all away and shaped it off. Because basically what's going to happen now is once it's healed, it's not going to be healed rounded, it's going to be healed flat.
Right.
So it'll still have the length, but it won't have the shape.
OK.
Whereas if I'd have had the operation, it wouldn't have the length, but it'd have the shape.
OK. So you stuck your finger in a coffee grinder, is that correct? Yeah. Oh, you took it off? Oh, well done. Now, how does that look to you? Because I haven't seen that before.
Oh, it looks really nasty. The scabs come off. It's not very nice.
My goodness.
Disgusting, isn't it?
No, it's healing. It's healing. Did they say that it would eventually just take time?
Take time, but it will heal eventually, and my nails should grow back as well.
Were you in a lot of pain?
No, it wasn't painful. It was more like a throb.
Oh, a throb.
Here and there, it felt like a little needle just poking it.
OK, so this goes this way?
Yeah.
Up.
Yeah, it goes like that, yeah.
Are you right-handed or left-handed?
Right-handed, yeah.
So do you find it really...
Difficult with it, yeah. But it's not too bad, really. My scabs come off, and I'm happy about that.
I'll give you an extra bit of this, just in case.
Yeah. It's lovely.
My goodness. There you go.
Lovely. Thank you very much.
Hello, it's Lorraine Donnelly.
Yeah, love.
Hello, like to come and take a seat?
Yeah, love. Oh, I need it down this side.
Say that again, sorry?
Me thingy down this side.
All
so
right.
do you wanna?
Yeah, so let me... Tell me that... So is it a rash that you've got, sorry? So...
I was bad under me red and sore.
Red. OK, yeah.
Under me and in my groin.
Yep, down below, yep.
Yeah, down below. But this side was more bad. It was like blistering and like a little abscess.
OK.
And it was bad. This is all cleared.
Yeah, all good.
Apart from...
Down there, yep.
So when I was getting a nice shower, you said, last night, it was gunging and...
Not very nice. OK, yep.
Not nice.
OK,
Get smell.
OK, yep.
Yeah, so... I could have seen a male doctor, but
Yeah.
I'm 62 years old
Right.
and I feel a bit embarrassed.
Yeah,
you
no,
know what I
that's
mean?
fine,
I know
yeah.
it's their job and they don't.
Yeah,
But
yeah, no, we understand.
Yeah,
we
I
understand
do.
that. And how are you feeling yourself? Feeling hot, feverish?
my face, all of it sweats.
Right.
Right, all the way down, all on it. And the only time it don't sweat is when I'm not so well. And look, I'm not so well.
And
it's
you're not sweating?
No.
Should we check your temperature then,
If you
just to
don't
make sure
mind,
it's all
yeah,
right? So we're
yeah.
doing this here.
Right.
Yeah, that's perfect. It's good. So should we have a little look down there? Do you want anyone else in with us? So one of the
You're all
nurses,
right.
are you happy for me
If
just
you,
to have a look?
If you want to bring somebody in...
No, I don't mind. It's really up to
I
you.
don't
Whatever's
mind. It's up
comfortable
to
for you.
If you want to bring some...
Yeah,
you
no,
know,
that's
Right
fine.
then.
Do you want to put yourself on there?
Yeah.
Sorry, the bed's a bit of a...
It's all right, darling.
Oh,
It
no,
ju-
little. So what I need to do is just, you just pop everything down for me and just let me know when you're ready and we'll have a little look.
Yeah, I'm right. I'm ready, lovey.
OK, I'm just going to pop some gloves on.
Right, lovey. It's in... Oh, God. Oh.
You all right there?
No, I'll have to sit up a bit more.
Do you want some help? Are you OK?
Could you just lower... higher this up a bit? That'd be all right, yeah.
Right.
There. Can you see it? Yeah. It's there.
And did you say there was some gunk
Yeah,
coming
it's
out
a
there?
bit... Yeah. There. That, and she's all there, and you can... Here. I'm not being awful. And here...
Can I
Sorry.
have a good feel? Is that
Yes.
all right? I just want to make sure there's no lump or anything there. I'm very sorry if it hurts.
There was a lump there, and I explained it. But further down, he had, like, down that bit, yeah, where that bit down there, it was a lump.
All right, you can get yourself dressed.
All right,
Should I help you up with this?
Oh, yeah, if you don't mind. Right, I won't be a minute. Oh, thank you.
All right.
God, to get up. Oh, God.
You OK there?
Yeah.
Yep.
Won't be a minute. Because by the time I come, they'll be sick of me.
OK, so looking at that kind of area, I mean, it looks like the spot that was, seen a couple of weeks ago, it looks like it's popped. So that's what all that gunk was that must have come out. It actually looks really nice and clean.
Good.
So you've still got kind of a bit of that fungal rash still a little bit there, but the infection, or what I think the doctor before thought that it might be a bit infected, so gave some antibiotics. It looks like that's done the job. So we'll have some more of the cream here. Is that all right?
Yeah, that's lovely.
Okay.
Oh, God.
You OK?
Yeah.
All right, then.
Thank you.
Sorry, I've got very cold hands.
Yeah, oh, no, lovely night.
All right.
Yeah,
Bye-bye.
I'm glad to hear it.
Yeah, I was telling them about my holidays. I said, I've just beat the Corfu. I said, do you remember what happened in Corfu? She went, yes, I do.
Is it a case of what happened in Corfu stays in Corfu? I don't know why we always say that. You must have had a good time.
I bloody did, yeah.
Do you know something, Veronica? You're never miserable, are you?
I'm not believing it.
Good on you, Veronica. Good on you.
Hello. Is it 7 here?
Mrs. Di Francesco.
Yes, I am.
Hello. I thought I'd lost you.
I lost myself. Yeah. Non mi rispondo, I lost myself.
Come in, take a seat. How can I help today?
Well, sometimes I have a terrible headache.
Okay.
And I get a pain from me. It go... I know I worry too much for my husband, Paul. Anyway, very poorly.
So you're always worried about him.
I have too much trouble in my house. Too much.
Why?
Because he said, you lost Rita. You're going to lose it, you lost it. Because I've done it twice. I work, I reach in Bradford. I say, oh my God, what happened now?
Oh, so you lost your memory?
Yeah, because I'm suffering so much from my husband.
Does the headache come on every day?
I have every day, just sometimes from dun.
Yeah.
I say, oh my, oh, what's happening? And he gone.
Okay. When was the last time you...
Because I suffer so much in me, that's all, because I love my husband.
I understand that.
And I see maybe day by day he can die.
Yeah, no, I understand. But the thing is, let's talk about you today, okay? Because you spend so long looking after your husband
that we also need to look after you. Okay.
Oh, lovely.
But let's just go through your memory. I'm going to ask you a few questions,
Yes.
which might sound a bit silly, but it's just to test your memory and see how it is.
Lovely, test
Is
me
that all right?
everything.
Okay, we'll test. So what's the day today, do you know?
Just a minute, I don't remember now.
It's okay.
And my husband told me as well and forgot. That's it, that's my...
So you're
my...
forgetting me like that. Okay, don't worry. Let's go with something a little bit
Maybe my head go crackers.
No. Well, I'll tell you when it goes crackers, okay? So don't worry. So can you count forwards from number 1? So number 1...
From the U, yes.
So 1?
Number 1, 1, 2,
yeah.
3, 4,
yeah.
and 5.
Good. So can you count backwards now?
5, 4.
Yeah, then before that?
3, 1.
Okay.
1, 2, and 3.
Oh, for me? Oh, thank you.
Oh, Shirley, my cold is killing me. No, you'll catch it. Don't catch it.
Oh. Yeah, she's gorgeous, ain't she?
Hello. Oh.
Right. Lovely to see you, Mr. Gibson. My pleasure.
I'm sorry, I'm sweating.
Oh, don't worry, so am I.
Come here. You're so clever.
I can see that obviously the memory is sometimes a bit weaker, isn't it? And that's why you forget sometimes where you're going and if you put things down.
I'm very, very...
How long has that
Sometimes
happened?
I go downstairs to cook.
Yeah.
I forget. All my pan come... I smell, you know, because it burn. It's up too much, this.
How long has this happened?
It's more than 2 years.
I think we need to get it tested and checked. What do you think?
If you help me, I will go in paradise.
Who do you have to help at home?
I go to the nursery with my husband.
So let me just ask you a question then.
Yeah.
Do you ever forget to lock the door?
Too much. Me forget all about.
Okay, because I think you might need some more help at home. So help with like maybe making the locks more secure, helping with the cooking and things like that. Well, what I'll do is I'll arrange the blood test, but I'll come out with you and we'll arrange the appointment together and we'll make sure that you get a card so that you don't forget it.
Lovely.
So let's go outside and we'll book the appointment for your blood test.
Oh my God, I wish
Oh.
you
You're lovely, don't worry.
You're lovely.
It's going to be fine.
You're lovely. I see lovely lady today, my God.
Ah.
Nice and gentle. It doesn't make
So we're just
people
going this way.
better.
Don't worry, we're just going this way. Come on.
Yes, all right.
Right, how are you doing?
Not that good.
Really?
Well, I'm doing good myself.
Okay.
I got back on my anxiety medication recently.
All right.
I just wasn't doing too well, but back on it now, feeling 100 times better.
Good.
My skin has got worse.
Has it really?
Like under my boobs is really bad, and my legs are quite horrific again.
Oh, gosh. Because we tweaked your lotions and things, didn't we, last time?
It just made it really painful, like my skin cracked a lot.
All right, I'm sorry that didn't work for you.
Oh, it's just a bit of miss, isn't it?
Well, unfortunately, yeah, that's often the way of it. So what works then? So the moisturisers you're putting on regularly?
And sunbeds.
And there's some... Right, OK. Us in the dermatology fraternity aren't big fans of sunbeds because, you know, but I can see why people like them because it can help. Right, would it be all right to have a look at some of these areas now then? Let's have a look.
These are like the worst.
Oh, yeah.
So that's quite, like, they look like bruises now, which is quite scary.
Yeah, so there's a lot, I mean, I can see that that's difficult to put lots of the creams on without getting it on the healthy skin and things. I mean, it's a little bit dry, isn't it, in some places? Yeah. OK. Like all skin conditions, it's all very subjective.
You can never find a cure, unfortunately.
Yeah, unfortunately for psoriasis there isn't. And it's very much how much the skin's bothering you to know how far we go with different treatments. Because most treatments and things, like you found with that lotion, unfortunately, can irritate, can make things a bit worse before they get better. So it's very much up to you. I mean, what are your thoughts?
I would like to try maybe something else if there's something you can recommend.
OK, yeah. Steroid for the redness we could try. We have to be slightly careful about how strong we go, but we can give you a steroid cream and then put some moisturising cream on all over, because I think that will help.
Will it ruin my tattoos?
Shouldn't do.
I paid a lot of money for these.
It shouldn't do, it shouldn't do. Well, why don't we just go for one thing at a time, maybe? Why don't we go for this, Humavate? You're going to increase your moisturisers.
Yeah.
And then we'll see you back.
Yeah.
And we'll see how things fare, OK? And I've just put this on once a day. And I think you mentioned when you first come in that your mood is better, your weight's coming down. Both of those have a positive effect on the...
I'm on vapes now.
Oh, fantastic. So there's three good things that will probably improve psoriasis.
Yeah.
You know, certainly in a lot of people, if those three things are improving, then psoriasis does get better. So, well, I'll give you this slip.
Thank you.
And then you know who I am, don't you, Dr Caris?
Yes. I refuse to see anyone else.
Oh, that's nice, thank you.
Well, thank you so much. Have a lovely day.
Okay, good luck with everything. See you later. Bye-bye. I mean, she's nice. She was positive, isn't she? And that's got a massive effect. If you can cope with your skin, you're going to do so much better. You know, I mean, how bubbly was she? It was lovely.
Everyone's got nicknames for me. It's amazing.
Like what?
Beth and Lorraine call me Ebbers.
Ebbers.
Assad and Ruth call me Ebony. My mum calls me Ebby, Ebbs. Idiot.
Really?
No, my mum doesn't call me that. People just go, bloody idiot.
Take a seat.
Hi, William. Hi, I'm Dr. Khan. Nice to see you. Come and take a seat. Right, I'm seeing you for your left toenail. Is that right?
It's right.
Ah, OK, right.
The left one was done a couple of weeks back.
Let's have a look at it, shall we?
It's this side.
Yeah. OK, yeah, we'll do an excision of that side there. Right, hop onto the bed. So what do you do, Will?
I'm a student at the university.
How are you? What are you studying?
Chemistry.
What do you want to do with your chemistry qualification?
Well, I'd hope to go into something like the atomic weapons establishment.
Oh, wow.
Go into that sort of stopping nuclear proliferation.
Stopping it? Good idea.
Yeah.
We like that.
Wow, we've got a right.
I know.
I'm going to be like this now.
I mean, we were talking about GCSE chemistry before you came in. It's not really the same level,
My mind's blown now.
Like Bunsen burners.
Yeah.
It's all right, I'm a medicine enthusiast. I tried to go into it, but did not have the A levels.
You're too clever for medicine. I mean, I'm taking off a toenail. You're going to be saving the planet. Right.
I don't like needles.
Right, don't worry.
Right, here we go, William. All right.
Okay.
Sharp scratch, sorry. Well done, mate. It's going to sting now. I know.
God, it's so awful.
I know.
Hello, come in.
Hi.
I'm Dr. McFadden. This is Harrison, our medical student. Have a seat. Right, my love. So, you're here for your knee injection.
I am.
You are. Which one do you want doing today? Because we can't do them both at the same time. The left one's worse than the right, yeah? Just out of interest, are you right or left-handed?
Right.
Harrison and I have been talking this morning. We've been trying to work out if you're right-handed, does that mean you're left-footed? Do you know? I don't know.
I don't think it does.
Does that mean that when I go for a walk with a dog, which one I start off with first? Yeah, I usually start with.
Do you? So you're left-footed, and that's why your left knee's worse. Pretend you've got a ball in front of you.
Yeah.
Which foot would you use to kick the ball?
But if you were Harry Kane, I'd probably be all right, yeah?
If you're
with
gonna
left leg, but when I'm kicking a ball for him and getting a goal, you know, going, hey, Bowser, you know, Bowser, whoa, catch this ball. I can send him halfway down Wibsey Park with the right leg than I can with the left.
Brilliant.
Yeah?
In your own time, can I ask you to come and sit up here, please, my love? So this is a great knee to look at.
Yeah.
Is there a point in your knee where you struggle with it the most? Is it, or is the pain everywhere?
It's just there.
Around
That's
there.
it, round there, nowhere else there.
On this, yeah?
Well, I had cancer last year. I had a breast cancer tumour removed.
You did
last
not?
year.
Gosh.
I did, yeah.
Right, so you're looking after yourself now.
Taken out in this year as well.
Okay. Right, so you understand the importance at the present time of looking after yourself. That's
yeah.
Brilliant. Tell me about your dog.
My dog is 95% idiot, 5% Staffy.
Ah, girl or boy?
A boy.
Nah. There we go. We'll have no blood, but just remember and wipe your X marks the spot off later, or people will be digging in there for pirate treasure.
Oh, yeah, I'm sure. Bit of uncharted, eh?
Absolutely.
Right, that's 1 out of 2. Here we go, 2 for 2, and then we're done.
God, I think I'd prefer if you just did it without
Oh, no,
anesthetic.
I don't think you would. You okay?
Yep.
Is it going a bit numb now?
You done?
Yep. Right, that's the worst bit over. Now you can sit back and think about carbon, lithium, what do we know? Plutonium, is that real?
Yeah.
Isn't that just from Superman?
Kryptonite.
Kryptonite.
Krypton's real.
Right, close your eyes, Will, and tell me what if you feel pain.
I can feel it, it's not painful.
Well, I think we should start because a bit of pressure is fine to feel, but if it gets sore or painful, let us know. We'll put a bit more medicine.
I'll tap out.
Right, here we go.
I can hear that clipping.
Don't think about it. Think about nice things.
Have you specialised?
I do a few different things. I do this, I do diabetes mainly, lots of teaching.
Have you got a title yet?
I am an honorary professor. Right, you're all done. Not too bad, eh?
Put your lovely bandage on now.
Right, Will, I'm going to leave you with Karen. Pleasure doing business with you and good luck.
Thank you.
I expect the world to be a safer place after you qualify.
Yeah.
They do scream, you know, the frogs.
Becky, don't I feel sick?
They do. Honestly, our cat once caught one, and I went out and you think, oh my God, what's that screaming? And it caught a frog.
I thought they just rib it.
No, it proper screamed.
And what was the cat doing to it?
Well, it got it in his mouth, but it was a bit rubbery for it, you see, so it let it go eventually.
Oh my God.
Well, we're having a disaster today. I don't know how much the receptionist will have told you, but the computers, they haven't been working at all. And that I can't log on at all.
Just them that dirt me so much, and when they go wrong.
Oh, I'm maligning them today, I tell you.
Yes,
Thank you. Come and have a seat.
thank you very much.
I'm Dr Moncrief.
All right, OK.
So I'm going to try and open it up.
Right, OK. This could take some time.
But it's already got its little egg timer, which means nothing's happening. So I think the best thing to do is for us both to acknowledge I can't see anything useful on here. So please, can you tell me what brings you along?
Yeah, I'd been to the doctors and I just happened to mention that I got a couple of areas of skin that were a bit odd, really.
A bit odd?
Well, they sort of were sore and never quite healed. And it just, this has been going on for a couple of years, sort of thing.
Couple of years?
Yeah, it's on my face then. I've got one on my leg.
Right.
And they sort of come and go, but they never 100% heal. And this one on my face had been bleeding, it scabbed over.
In the past, have you had any other trouble with your skin at all?
No.
And would you say you've had much in the way of exposure to the sun?
Probably in my youth, I'd probably sunbathed quite a lot, yeah.
So where is it on your face?
So it's just, you can hardly see it on there now.
Thank you very much. So for this one here, it's certainly it's not anything dangerous at all.
Right.
It's likely to be a bit of very early sun damage.
Right.
Yes?
Yeah.
And people worry about that because a small proportion of them can eventually go on to be a type of skin cancer.
Yeah. So this is a big day for this little one, a big day for you two.
And you struggling with your knee?
Oh, big time.
And how's your head today? Oh dear, that were a big sigh, weren't it?
Oh my gosh. It's bigger than what I thought it was going to be.
Yeah.
And I believe you've come out your eye.
Doing the garden last weekend, it's felt a bit bruised and it's got bigger and bigger every single day.
You show me your muscles. Yeah, Dad said that my muscle was bigger and he was right.
So, are you ready for my big end?
Yes, the big finale.
You've listened to me. You know, that's the big thing. I mean, I'm 82 nearly.
I know, but looking gorgeous.
How can I help?
Yeah, so Eva is not feeling well. From yesterday, she had all night temperature. She was vomiting. How many times you vomiting yesterday?
3.
And what else?
Cough.
Did you have a cough?
Throat pain.
Oh, has you got a sore throat as well? I'll
Yeah.
have a little look at that.
I feel cold.
Do you feel cold? That might be because you're a bit warm. Funny that, isn't it? Let's check your temperature. Great. There we go.
This is weird.
Good girl. Slightly raised again, isn't it?
It helps. Why is it taking long?
Good girl. Okay. Now then, let's have a look in your throat. You're going to go, ah. Oh, goodness, you're good at that. Just relax your tongue a bit. Wow, what a tonsil. Come and see this tonsil. I bet it's sore. Open your mouth. See how big that tonsil is.
The right one.
So it's one really big tonsil. It's also got some white stuff on it, hasn't it?
Is this normal?
It's quite big, isn't it?
Yeah. It's very big.
And it's... If you're ticklish, try to relax.
She's snoring.
Yes, I should think she does. Does she snort every night or just
Every
now
night.
that she's unwell?
Every night.
Just put your chin up for me. There we go. All right, that's all right. Okay.
Chill out.
How did you know where my tickle spot is?
Let me just listen to your chest at the back, my love. Just nice big breaths in and out through your mouth.
What?
Copy me, copy me.
That's why I can't believe her sometimes when she's seriously sick or not.
Yeah, I
Because
know.
she's so naughty.
Copy that, and again.
Okay, my love, that's fine. Now I need to check your tummy over, don't I? So would you stand up and come over here for me? Good girl. Lie yourself down. Excellent. I knew you were ticklish. Why did I even think this is going to be easy, eh? All right. Off you get. There's a good girl. Now, I'm going to ask you a few more questions about this snoring and see if it's something that perhaps might need to be referred for. They do sleep studies. So tell me exactly what you notice when she's asleep. Does she ever stop breathing for a few seconds and then sort of
Yeah.
like that? And how long a time is it that she's doing that?
It's like going like this all night, no stop.
Does she always sleep on her back or
She's sleeping every side.
Which way? All right then. Right, let's do that referral now. And here's the penicillin. It's 1 spoonful 4 times a day for her tonsillitis, okay? All right, thank you for coming in. Nice to meet you. Bye.
Bye.
Now, the one on your leg. Yes, that one's much more characteristic. So that one's a bit, as you can see yourself, it's a bit thicker. It's progressed a bit further.
Yeah.
So none of these is dangerous. The one on your face has got so much better that I think we might well be able to help it on its way just with some gel.
Okay. Right. Yeah.
This one, the way to be 100% sure would be to have a little sample taken of it, a biopsy, to be looked at under the microscope.
Sure.
This is not an emergency thing
Right.
because
No.
these are not dangerous cancers, right?
So is it that basal cell?
Yes.
Is that what it is?
The old-fashioned name rodent ulcer, modern name basal cell carcinoma, which is rather an alarming name.
It is rather, yes.
But it shouldn't be really, because it's not the sort of thing that would spread anywhere else in the body and make you ill. It's not like malignant melanoma. It's not like that at all, at all.
No.
I'm going to have a go at entering this on here, but I suspect you may have to join all your people who've been here earlier, and I've got to write it down. And when it's working properly, I'll have to put the details on the computer and do the letter.
It's a good job we've got a pen and paper still, isn't it?
Well, we can still talk to each other, whether the computer's here or not.
Now then, you. Are you going to smile for your Auntie Debbie today? Are we smiling today?
And as long as I'm mobile and I can keep smiling, I'm a chance.
Well, we all got to think like that, haven't we? All right.
Hello. You're a smiler, aren't you?
From my point of view, you're doing pretty well.
Yeah, that'll do. Yeah. Well, smiling. It's nice. It's lovely to see you, innit?
Yeah.
There we are.
Come in. I'm Dr. Khan. Come and take a seat. How are we doing?
Oh, not bad. I can't complain.
Oh, that's good. Come and sit down. How are things with the diabetes?
Well,
oh, perfect. Yeah.
as you can see, my mornings.
This is the most organised book I've seen in a long time.
It's about all is organised then.
All right.
It is.
These readings are really good. Now, your blood test here, as you know, shows us your average reading over the last 3 months, and yours is excellent. It's better than it was before as well. Your average reading is 7.5, so bang on where we want it to be, really.
What about my waterworks? Is that all right?
What do you understand about your kidney function?
Nothing.
Nothing?
All I know is I'm diabetic. I don't have a bladder. I have a pouch.
OK.
I have a stoma.
Right. That goes directly into your bladder?
It's gone.
Into me.
What happened to your bladder?
I had cancer.
Oh, did they take your whole bladder out?
Yes.
OK.
Everything.
Right, OK.
I had a massive polyp removed from my bowel.
OK. Was that bleeding?
Yes.
It took him 150 minutes to remove it.
Wow.
And I watched it all on telly.
Yeah, were you awake?
I was
Yeah.
wide awake. It was massive.
Fascinating stuff.
I've also been in with meningitis because I had sciatica and I went for some injections in my spine for pains in my legs. I got out of bed about 11:30 and I collapsed on the floor and she dialed 999.
Yeah.
And I was unconscious for 3 days.
Gosh. So let me get this straight.
Believe me, I've heart attacks, started with heart attack.
So let me just get this right. You've had bladder cancer, you've got no bladder, you've got that back now.
Right.
You've had a massive polyp removed from your bowel, thankfully just a polyp. You've had meningitis, you've had heart attacks. Let me tell you something. Your diabetes is perfect, beautiful.
But it's still got it.
You've still got it.
I'm not bad for an 88-year-old.
You're not bad. Well, I don't know. Looking at that list, people might argue with you there.
No, I've got through them, haven't I?
You've got through it, but you're still smiling.
Yeah. I know my mate now is getting me 2-3 plates.
Yeah.
Well, I want to shake your hand because you've been through so much and you are so positive and smiling, even without that tooth. Right, thank you so much.
Thank you very much.
Nice to see you.
Yeah.
Thank you very much. Cheers, lovely to see you both.
Thank
Take
you.
care. Bye-bye.
Bye-bye.
Which way did we come?
Quicker that way.
Quicker this way?
Yeah, just go around there. Cheers.
Thank you.
Bye.
Can I have that back, please? Hey, what's your name? Hey, you've got all shy. All right then, see you later.
You're in charge. Give that to chemist, he'll give you some medicine. Yeah? See you later. Oh, I love them shoes. See you later.
Good night. See you later. Good night. See you later.
Good morning, the Rich Medical Practice. Vicky speaking.
Now I'm going to go into full lecture mode.
Please don't give me a lecture, because I know all about it.
She keeps coming out in like these little spots, but she's having black poos.
It's my past urine, it smells horrible.
How long have you had the smelly urine for?
Oh, too long.
And I found that I was having some menopausal rages, particularly with drivers.
I'm really proud to work at the Ridge.
Yeah, I am.
I feel that working in the Ridge is a bit like a big family.
It feels that way, and literally, loads of us are married to each other.
One of the things that I really like about my job is how varied it is.
No 2 days are ever the same.
You never know what's going to hit you.
We have all sorts of characters coming through the door with different stories to tell.
There's all different cultures and all different languages.
We have to be ready for all sorts.
We can get anything from a cough and a cold to a cardiac arrest, and it just seems to be all in a day's work.
The next thing you know, it's 6:10, and you think, gosh, where did today go?
Come in. Come
Hello.
in. Oh, sorry, I've no
Hello,
business.
Doctor.
How are you doing?
Well, Professor, isn't it?
Oh, God. Yeah, come
I'm on it, right.
How are you doing?
All right.
You
I'm
enjoying
okay,
the
actually.
weather?
Bit warm.
It's warm, isn't it?
Why I've come to see you is this only takes 60 units.
Yeah, and you're on more.
Well, yeah, I managed to cut down, but I don't know how long it'll last.
OK.
So if I have to go over 60,
Yeah.
it means 2 injections.
Yes.
Have you got another?
Let me see. I don't think it does. This particular insulin only comes in this pen. You can get cartridges,
Yeah.
but they would only fit the same kind of pen.
With the same amount
Yeah.
in? What about changing my insulin?
Well, the problem... It's up to you. OK, so your diabetes at the moment is quite well controlled, and it
Yeah.
has been for some time.
Yeah, it is. It's not bad, yeah.
We can try and find an insulin that's similar to this, but a lot of the pens for a lot of the insulins are exactly the same
Still on
as this.
60.
Yeah.
But I'm managing my diet a little bit.
Good. Because that was the other thing we talked about last time, is that
I mean,
sometimes
if I-
you had a bit of cake and ice cream and...
I know, I've cut them out. Apart from pudding she brings in now and again, shouldn't do, but there it is. But...
Right, you can blame me.
Come in.
Hello, are you OK?
It's a cracking knock you've got, Stephen.
I know, well. Don't want to mess around, do we?
So, Dr Harris, hi. How can I help you?
I've got like some lumps on the back of my neck, which initially I thought was like an ingrowing hair because I shaved my head.
Yeah, yeah.
But it didn't manifest itself like that. And then I've come back from holiday
Yeah.
and it started to go red. Now, I went to the chemist
Yeah.
to see if they could get some cream, and he looked at it and said he thought it might be infected and to come to the...
Some antibiotics,
yeah, come and see the doctor. I have been using like an antibiotic cream that I got in Turkey.
So how long did you have the spots before you got
I've had them probably 2 months.
Right, OK.
And it's not... Yeah, to be cool, you see a little bit.
Yeah. And you've not been bitten or anything like that?
No, I don't think... Well, I don't think so. It's more hard. The spot's more of a solid spot and nothing comes out of it.
It's certainly fit with a folliculitis, which is an infection in the hair follicle, which you get probably because you shave your hair.
Yeah.
So you have a tendency to get that. But then this has clearly got more infected on top. So you need some antibiotics. And you need a good course of penicillin. You're not allergic?
No, not to my knowledge.
So if you take that, that will settle it down quite well.
But what's going to happen to the... Do I just have to live with the spot thing?
Well, they'll calm right down with the antibiotics.
Yeah.
And then you really just need to just be careful with the shaving. And sometimes just some antiseptic that you can use in that area.
Right.
But it is a tricky area to... Right. Because what you're doing is you're blocking the hair follicle because you're shaving off the hair.
Yeah.
And then it just gets a bit infected. So if you keep antiseptic on, usually works. Sometimes medicated talc helps. And that dries it up, but it's also... will treat it as well.
Right.
So try those couple of options. But it's flucloxacillin you need.
And maybe let my hair grow.
If you want to, yeah.
I don't think so.
Hey?
I end up looking like Coco the Clown.
You've got to grow a ponytail. That's my advice.
Yeah, well. Right, thank you.
Well, let's wait for this.
Oh, God, yeah, I forgot.
Don't jump ahead of the printer.
Yeah.
So take the whole course, 10 days.
Yep.
And it'll all settle down quite
marvellous.
nicely.
Thank you very much for your help.
Cheers, thanks. All the best.
Have you had any thoughts about losing weight or how?
Yes,
how
I have.
What are your thoughts?
I've been to Weight Watchers. I lost nearly 3 stone.
OK, when was that?
A while back.
Right. But a healthy diet would help reduce your need for the insulin.
I need to lose some weight.
Yeah. Now I'm going to go into full lecture mode, so just bear with me 1 second.
I know what you're saying.
Yeah.
Please don't give me a lecture.
No.
Because I know all about it. Been
Yeah.
to Weight Watchers, Slimming World, I know all about it.
But we have programmes that you don't have to pay for that we can refer you to.
I know what to do.
Yeah. Well, there's free exercise programmes that we can say you don't have to pay.
And now do I get the breath to do with those then?
Well, you build up slowly until your breathing gets better.
No, that's all I wanted to know.
Okay,
Yeah.
okay.
I'll have to lose some weight, yeah.
Tell me what you're thinking when I'm talking like this.
I'm thinking I know what I've got to do, and I don't want to do it.
Yeah, fair enough.
I mean, you can send me in all the courses you like. I know what I've got to cut out, how much I've even got the scales there to weigh my food, my potatoes.
Okay.
So I know what to do, so there's no point, is there?
And do you mind me asking you what's stopping you from doing it?
No, I've got a sweet tooth. I enjoy my food.
Yeah. It's hard. I
know
find
it's
it hard
hard,
as well.
yeah.
Okay, as always, we don't need to do very much with your insulin because you seem to manage that very well yourself.
Yeah.
Your liver and your kidneys are working well. Your
Good.
cholesterol is good, 3.5.
Oh,
Your
it's not
urine
bad,
test
yeah.
is good as well.
Mhm.
So I'm pleased with everything else.
Yeah.
So we just need to work
It's just
on
a
that.
matter of...
Willpower.
It is, that's what it
Willpower,
boils
isn't
down
it?
to.
Yeah.
You know, can hear the ice cream bell and I think, ooh.
Yeah. I understand. I have to have the same conversation with
The thing is,
myself.
I've stopped getting in now.
Okay,
You
that's
know,
brilliant.
Takeaways finished, ice cream finished, puddings finished.
Yeah.
What puddings do you make?
I just make homemade ones.
Like what?
You know, like apple and rhubarb crumble and...
Custard and cream and...
God, that is tempting. It'll be gone next time.
Next time you see me, I shall be...
Dancing in,
9
slim and
stone.
trim. Right.
Okay.
Lovely to see
Yeah,
you.
nice to see you as well.
Right, thanks very much.
Thanks a lot,
Nice to
Doctor.
see you.
Right, and nice to
Cheers.
see you
Take
as well.
care.
Thanks,
Bye-bye,
love.
bye-bye.
Bye then. Bye.
Hello, how can I help?
She's been having quite a lot of reactions, quite nasty allergic reactions to something, but don't know what. And she keeps coming out in like these little spots all over her face or everywhere, but she's having black poos,
Okay.
and it's...
You brought some?
I have, yeah.
Okay, that's all right. We'll have a look at that as
But
well.
she's
That's very
literally...
helpful.
She had an allergic reaction to a nappy yesterday, and just before she had those poos,
Yeah.
literally from head to toe, she comes out in them. It's like that.
And has she been poorly or anything?
No,
Has
she's been fine.
She's
She
been
had
fine,
sickness
yeah.
bug, but she's had these for quite a few months.
And she's not had any temperature. She's her normal self.
Yeah.
Feeding fine.
Yeah.
Passing urine okay as well and
Yeah,
everything.
yeah.
Okay.
She's been a bit cryy,
Crying.
but her belly does tend to swell.
And that's when she.
Yeah, she gets quite irritable about it.
Right, shall we have a look? I'm just going to check her temperature. Oh, I'll put it back. Oh, Claire. Shall we just have a look at the nappy first? Yeah? Okay. Right.
Hey, Baba. Hey.
It does look really black, doesn't it?
What are you crying for? What's up?
My main concern at the minute is her, this poo that is quite black.
Yeah.
Okay? Right. Oh, I'm so sorry. Can I just quickly check your temperature? Oh, bless. Just gonna...
Baby girl.
She's normally a happy child or...
Yeah.
She's just not been feeling well, is she? Oh, bless. Can we have a feel of your tummy? Yeah? Just a bit quickly. Yeah, we'll do that over there. We'll do that when she's... Yeah, okay?
I'm with you.
I'm sorry. And can I see her nappy area as well? Let's get some looks. Right, that's fine. You can dress her back up. Right, like I said, from her skin point of view, the amount of reactions that she is getting, they do sound like allergic kind of rash.
Yeah.
So that's something that definitely needs looking at, okay? I think I'm going to speak to one of the pediatric colleagues at hospital,
Right.
okay? I've just run it by them and see what they say. Are you okay to wait in the reception area?
Yeah,
Let me give them
yeah.
a quick phone call and we'll get you back.
That's
then,
fine,
okay?
thank you.
you. Hi, my name is Dr. Hassan. I'm one of the GPs ringing from Ridge Medical Practice. Just ringing to refer a child to you, please, because she's noticed some black-coloured stools last night. But I'm just a bit concerned, where's this? Yeah.
What I can tell you about working here is that you will never be bored.
And often when I'm driving to work in the morning, I'm thinking, I wonder who I'm going to meet today.
How come you two got the same top?
Oh, because it's the uniform.
Is that been yarn? I love having regular patients. It's like seeing your friends.
Say ciao.
Ciao. Ciao, ciao.
Look who I've got, Debbie.
Are you okay?
Ridge patients definitely put a smile on my face.
You're a fancy little doctor, aren't you?
Well, I think we're two of a kind.
And so many of them have this really great sense of Yorkshire humour.
Come and kick you then, can I?
But I'd rather you didn't kick me, really.
He's my best friend, anyway.
Dr Harris.
No, Jesus.
Oh, right.
I've been here now for nearly 9 years, so I've seen babies grow up, I've seen families expand.
You start to build up a relationship not only with individual patients, but you get to know whole families.
He's a really classy boy.
She shoots webs.
Shoots webs?
Yeah.
What do you like the best about school?
Dinner.
That's my favourite time as well.
They make me chuckle, and I hope I make them chuckle.
Is your bikini away for another year now, then?
Bikini wet at 82, where you
He's a happy boy. Sometimes it's just the simplest thing. Patients just saying thank you, that makes all the difference.
I would like to award you a sticker.
Oh, thank you. That effect can last for days or even weeks sometimes.
You've changed my life.
Oh.
No, you have, Dr. Khan. You've changed my life.
Oh, I'll take that.
It gives you a real feeling of self-worth. It's one of the many reasons why I love doing what I do, and I love my job.
Hopefully, when they go out the door, they've got a smile on their face and they feel a little bit brighter and happier.
I've got good doctors.
Coming to see you.
That way, Fisk.
Hiya, come on in. Dr Harris. Hi. We met before? I think we probably have at some point.
We may have done it, so
Yeah,
yes,
we'll have
yes.
done.
A long time ago,
Yeah.
probably.
Come and have a sit down here.
Right.
How can I help you today?
Yes.
So I'm Dr Harris and this is Navdeep who's with me.
Yes, it's this was
Doctor observing.
right at the back of my leg.
Whereabouts? If you just stand up and turn round and we might
Yes,
get a
we're
better
to
look,
see
might
it,
we?
see it
yeah?
better, yes.
Yeah, it's like a keratin horn, isn't it? So we could just shave that off and get that removed and then burn the base of that. That'll be fine, yeah?
Yes.
All right?
Right,
Good.
yes.
So let's get you comfortable.
Yeah.
So what would you normally be doing today then?
Not much. Well, it's a nice day. I'd probably just go for a walk.
Yeah? And where would you go for a walk?
Probably walk down. I live up Buttershaw, so I'd walk down into Wibsey Park and watch them play bowls for a while.
Oh, yeah.
Yeah.
Don't you fancy playing bowls yourself?
No, I used to.
Did you?
Yeah, yeah.
How competitive does that bowls get?
Oh, very.
I think it does as well,
yes,
yeah.
Yes.
All these old people, you can just tell they're getting really, they're getting really nasty with each other.
Definitely.
So, you OK for local anaesthetic injection?
Yes.
This is the painful bit, it'll sting.
It does sting, will it?
OK, just bear with it. Little scratch, well done.
Ooh.
Great.
Yeah.
How does that feel?
That's OK.
Feels OK.
Yeah.
You still OK there?
Yes, I'm fine.
If you need a breather at all, just tell me, won't you? Looks as though we've got the route as
I
well.
got a taxi down this morning.
Oh, did you?
Yes, yeah.
We'll just put your dressing on and then we'll review it in about 10 days just to make sure it's healing OK.
Yes, that's fine.
But I expect there'll be no trouble at all. I'm going to lower you down now.
OK. Shall I leave the dressing on?
We'll keep it dry for a couple of days.
Yes.
The thing I just don't want you to do is catch it while it heals.
Yes.
I'll send you a letter about what we found on under the microscope.
Right.
So it's all action, isn't it?
It is, isn't it?
Yeah? Right, all the best.
Oh, lovely.
OK, take care then.
Thank you very much.
Thanks.
Thank
Bye-bye,
you.
love.
Bye.
Right, Baba. Come on, princess.
Come in. Hello.
Hiya.
Hi. Right, Mum. So, spoken to the pediatric doctor in hospital.
Right.
Okay. They will see her now.
Right.
Okay.
Do you know what
So-
it could be?
it's difficult for me to say. Okay, so it could just be nothing. Okay, it could just be because obviously whatever we eat also gives color to her, poo as well.
Yeah.
Okay, and considering how well she is, I'm not worried that it's something sinister or anything like that.
Right.
But still, it is concerning enough for me to have them have a look and make sure everything is okay. Is that all right?
Right, that's
yeah?
fine.
Okay?
Yeah, that's fine.
There you go.
Thank you very much.
Thank Take care.
You too. Oh, thank you.
All right, thank you. Bye.
Cheers. See ya. Come in.
Hello. Hello. Take a seat over there. Now then, what's your name? Libby. Hello, Libby. Who's this fella? Daddy. Your daddy? Hi, Daddy. Well, my name's Debbie. So you're Libby May. What a lovely name. Now, what's the problem?
Well, she used to have eczema in her arms and everything. But then I managed to sort it out. The creams and everything that I used weren't working. But Vaseline started to work and it used to get rid of it. But then she came out with chicken pox and loads of chicken pox.
Yes, last month, she had.
Yeah.
Oh,
but
darling.
she's been scratching.
Yeah.
And it's got really bad everywhere now.
Oh, Libby.
Last night, she keeps picking at it as well.
Yeah.
So, but last night, she'd scratched it that bad. It were all, like watery.
Let's have a look at this one as well.
It's all down her arms and everything and on her hands now.
Oh,
Look.
sweetheart. Can you take your top off and let Debbie have a look at you? Ooh. Oh, are you good? Or is it a bit stiff on your head? Has it got buttons?
I don't know.
Me and your dad are as bad as each other where dresses are concerned, aren't we? Darling. Here, leave it round your neck. Right, come here, let me look at you. Oh, you're sore, aren't you? Take your temperature, this goes in your ear. It's not uncommon when they've had chicken pox for their eczema to really flare up. We'll have to get you back on all your creams and that, won't we?
See, they didn't really help. She's even been on the steroids and everything.
Come here, I want to listen to your chest as well, because you're coughing, aren't you? You got a bad cough?
Yeah, she has. Really bad.
You're still smiling though, aren't you? Turn round, my love. That's a nice ponytail. Right. Don't tell your mum that me and your dad don't know how you do your dress, will you? Your dad might get in a bother.
She wouldn't see her mum. I've got custody of her.
Have you?
Yeah.
Just her, or has she got some other children?
2 girls.
And how are you doing?
All right.
And how old's your other one?
7.
And do you get any help? Does anybody help you?
I've got another girlfriend.
Right. She's lovely, isn't she? Have you got any sore legs, Libby?
Not about her legs.
Right.
Can you do it? How do you want, Daddy?
So she's got a flare-up of her eczema, which she knew about. Yeah. Don't worry about it because we can get on top of it. She's also got a temperature and she's got a few little crackles in her chest. It's possibly a virus because she's got a really snotty nose and everything.
Constantly.
She's constant runny nose.
Never can get rid of it.
I'm going to give her some antibiotics because her skin needs some antibiotics where it's really red and sore. But I'll give her an antibiotic that if there were any chest infection, it'd treat that as well. Okay. I'll give you all the creams, we'll go right back to the beginning, and then we'll see how she goes. Is that all right?
Yeah, that's fine.
Do you like coming to doctors? Do you like it? So I've put the moisturiser back on repeat, and so every single month you can get that. Right? So never wash her in soap. Stand her up or shower her and get it on your hand and just make it like a soap and use that to wash her.
All right.
So we use that hand.
I've never been told that before.
Come to the right woman today. And 4 times a day, moisturiser all over. Everywhere where she's sore, this is a steroid cream. Yep. And it's a moderate steroid, not for her face at all, but all them sore parts here, put that on twice a day.
Okay.
Okay, and then that's some antibiotics, which I think she needs as well. And I think her skin should get a lot better. She should be fine by next week.
Okay.
And are you going to put your cream on? You're going to help your daddy? All right, then.
Come
What
on,
beautiful manners. Bye-bye. Okay. See you later, darling. Thank you very much. You're doing a lovely job.
Thank you.
See you later.
Over the last year, I lost my dad, my nan, my uncle, my best friend.
Oh, goodness, that's tough.
I think as a GP, we go through a lot with our patients. We have a lot of deep and meaningful chats with our patients.
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I do.
So, I mean, that's a lot of stress, isn't it?
Yeah, and a lot to talk about it.
Yeah, yeah.
I particularly remember having to break bad news to a lady who was only young, with children who had cancer everywhere.
He'd been in hospital before, you bring them out. And this time, he went in and he didn't come out.
She died a couple of years ago now. But
It can be quite an emotional roller coaster at times.
When that's happened, it can put it's a dampener on your day. You know, you need your spirits lifting a little bit, because it is sad, but unfortunately, it happens.
she'll always be a challenge, that lady.
Good morning. Have a seat. I'm Becky, one at Nurse Practitioners.
Hi.
Hiya, how can I help today?
The thing is, I've been having problems eating till I get a breakfast in town. It goes right through my system. It gives me diarrhoea every time.
OK.
And I've been out for the last couple of weeks.
OK, so have you had diarrhoea every day for 2 weeks then?
Yeah. Till I pass urine, it smells horrible.
OK, so
It's horrible.
you've got smelly urine as well?
Yeah, I've had it for a long time.
How long have you had the smelly urine for?
Too long.
For a long time?
Yeah.
And how many times a day are you having the diarrhoea?
It's every time I go for something to eat, like a breakfast in town. So I have a breakfast every morning, see, in the cafe.
And what do you have in the cafe? Is it like a fried breakfast or...?
Egg, bacon, sausage, tomato and beans.
And you've eaten in the cafe for a long time, have you?
Yeah, I always have a breakfast in the morning.
And have you been travelling anywhere or done anything different?
No,
or?
not really, no. I went down to my mum's 2 weeks ago to arrange for a funeral.
Oh, dear.
I lost my brother.
Oh, so you've had a rough time of it, haven't you?
I lost 2 husbands. 2 one uncle, 2 cousins, and my dad. It's gone all wrong.
Yeah.
It's gone all wrong.
Yeah.
I don't think it's possible to work in primary care, really, in a GP surgery without that sense of team spirit.
Do you have anything that needs doing, taking out?
I could probably do some exercise. Do you want to just run me around a bit?
Oh, I don't do that myself.
You'll get your reward in heaven.
I'm going to heaven anyway.
Yeah, I'm not.
People who start as colleagues often end up as really good friends.
Would you like one of my tomatoes?
Are they
Do you like
homegrown?
tomatoes?
Yeah, I do,
Yeah.
I do.
Have a couple.
Small is beautiful.
Who's making your wedding cake, Amir? Me.
Have you ever made a wedding cake before?
No, I can try.
We do all get together outside of work from time to time.
Are you coming to our night out then?
I probably will come, yeah.
I go to the gym with Dr Chris Harris every night of the week, pretty much.
Hi.
Cheers, mate. No, it's nice to see you.
The cheekiest person who works here is definitely Amir.
I think everybody's noticed that.
And his partners in crime tend to be Debbie.
Is he there?
Yeah.
Right, get out.
And Karen.
Karen!
They all have a good sense of humour.
Yeah, they do, and make our days go a lot quicker.
We have lots of fun, we work really hard, but we don't take ourselves too seriously.
And I think we go through a lot together and quite highly emotive times, and I think it's such a fantastic supportive team here, and that brings us all closer together.
So, how are you doing?
I'm all right.
Yeah. So, last time I saw you, you mentioned that you had a problem with your finger and it kept getting stuck.
Yeah,
when...
they're both getting stuck.
Does it hurt anywhere?
It does hurt.
Show me where.
Mostly all my fingers, there.
Yeah.
About there, look.
Okay.
And about there, look, and up there. That hurts.
Can I have a look?
Yeah.
Is that okay?
The big finger there. Trigger finger.
So just make a fist and then in again and then out. Okay.
It's right there.
Yeah, I can feel it.
You know, and I've got one there and all.
Do you know what trigger finger is? Do you know
No,
what
I don't
happens?
know.
Okay, so in your hands, you've got these tendons that move your fingers up and down, and they move within a sheath, really. So it should be a nice, smooth movement like that.
Yeah,
but sometimes the sheath gets tightened around the tendon, and it's not easy for it to move back and forth.
And it locks,
yeah.
I know that part,
So what we're hoping to do today is pop a little injection into where the sheath is, where it's got tight, and put a bit of medicine in, some steroid, to try and reduce the inflammation and try and release it so it goes back to being a nice, smooth movement again. So if we can just move you across here a little bit, and if you just turn your hand around. I've got to say, you're the smartest man I've seen in a long time. You're so well dressed.
Oh, thank you. I'm too good for Leeds, and I'm too
good for Leeds. Right, you're just going to feel a sharp scratch now, OK? And it'll just be a bit sore.
I'm used to them.
Sorry, here we go.
I've had loads in the hospital. I've had needles in my head.
Needles in your head?
Yeah.
What was that for?
Oh, that's because they found some cancer under my eye. I still got a scar. Yeah. They got it all out. I said, and then later, if you lost your eye, I've only had one eye.
Oh, bless you.
That's all done. It might not get better for a few days, but it should get better. This time next week, it should be feeling a lot better.
Yeah.
And I'll send you out another appointment to do the other side, probably in about 2 or 3 weeks' time. Is that all right?
Yeah.
I'll say goodbye, but I'll see you again for the other side, OK?
I'll help you up, yeah?
Yeah. Oh.
Are you OK?
I'm all right. Yeah.
Right, love, there's your trolley. I'll help you with this outside, OK?
I forgot to tell you, I was a role model a couple of weeks ago. I walked on the stage and I got into the final. But I didn't win.
It should have been you. I'm sorry.
I know. It should have been me.
I know. It's not good, is it?
It should have been me. Like that song.
That's fine. Do you want to come behind the curtain? Can you give me a cough? Can you pull your tummy in and push it out? That feel OK?
Yeah.
Yeah? Thank you. Have a little feel. I'm really sorry, my hands are always cold.
That's right.
I suppose the only other thing that we could do this morning that we haven't done yet is have a little feel into your bottom. So if you lay onto your left-hand side, facing the wall, that's it, and then draw your knees up to your chest, and then you'll just feel some cold jelly on my gloved fingers. Is that all right?
That's fine.
OK, lovely. That's fine. Well done. So your tummy feels fine. You've no high temperature at the moment. OK, that's good. This could be a bit of a bug that you've got, although it's gone on, 2 weeks, hasn't it?
Yeah.
So I want to do a couple of poo samples, OK, for you to do. And then I want you to get some bloods done this morning.
That's fine,
Is that all right? Yeah. Do you think you'd be able to go home and have a cup of tea, and we need to get plenty of fluids into you?
I will do, yeah.
Yeah, OK, and make sure that you're weeing regularly.
Yeah.
We'll send that urine off as well, OK? If your pain and everything gets worse, I need you to come back sooner. The blood results will be back by the beginning of next week, OK? And I'm just going to sort out for somebody to do your bloods now. All right,
okay,
so you can put them in your bag. So have a seat in the waiting room.
Yeah.
And you'll get called through shortly to have a blood test.
OK.
Is that all right?
Yeah, fine.
Yeah. You take care.
Yeah.
We've had a message from the health visitors to say that you've been concerned about his arm, actually.
Yeah.
So tell me what you've noticed about his arm.
Right, his left arm, it's always, at the back of him, and he's constantly got his fist clenched.
Right, and that's been ever since he's been born?
Yeah.
So tell me about his birth. Did you have a normal delivery?
He was born by emergency caesarean.
Right, and why was it an emergency? Did he just not progress?
He was planned to be delivered by caesarean anyway.
Right,
because I'm insulin-dependent diabetic.
Fine. So is he your first baby?
No, it's my third.
Third. And you're worried about his left arm?
His left arm, yeah. When I hold him, it's always, at the back of him.
Right. Let's strip him off and have a little look at him on the bed.
His nappy?
Yeah, that'd be good, because then I can listen to his chest and check his lungs and everything as well. Do you smile nicely? He does. Do you smile at your mummy? Hey? Hey? Are you going to smile at me?
His muscles, she said, more like...
We've got a bit of...
Oh,
it's
you've
all right.
been sick, darling. We've got a baby here.
There you go.
It's because he's just been fed.
Has he? Oh, dear.
I feel loads of bibs, don't we, darling?
Oh, yeah.
He seems to have more muscle at his side than this one.
Can you turn him away from me again? I'll just see. He's smiling at that. He's not cross.
No, he's not.
Moving his...
I mean, he does use it, but not quite as much as his right one.
I can't really see that there's any muscle wasting on that side. He's really active with that arm. But what you're concerned about is the positioning of it being behind his back. Has the health visitor actually witnessed it?
We tried putting him on his tummy and he just won't do it.
Should we try that? Let's try him on his tummy on here.
We don't use them that, do we, baby? I can't use one, can we?
Why not?
His arm goes really, really stiff.
We're not so keen on tummy, are we? Oh, do we not like that?
We don't mind it, actually.
Do we not like that? Do you mean like that?
Yeah.
Oh, darling, pick him up, then.
Just look.
Where, darling? So you didn't mention it at the 8-week check. Had you not noticed it at that point?
I hadn't really noticed it at that point, but when I was pregnant with him, on his scans, they did say that there was a possibility that he wasn't going to be born with one arm, because they couldn't see his arm on the scans. I mean, I didn't find out I was pregnant until I was 23 weeks, and I had my scan at 24 weeks, and that's when they noticed that I was really going to have one arm.
That's interesting, isn't it? Maybe he was in the womb in a funny position with his arm. I think probably just leave it with me. I'm going to just check with one of my colleagues to see whether there's anything we need to do about this. It might be that we ask the paediatricians to have a look at him.
Yeah.
Leave it with me and I'll give you a ring in the next few days. Is that all right? Yeah. All right. OK. Bye-bye. See you, bye.
See ya.
One, two, three, it's good to be me.
Come in. Hello. Hi. Is it
Morning,
Kevin?
how are you? All right?
I'm good, thank you. Come in, have a seat.
Good. Morning, girls. You all right? Good.
Kevin, my name is Dr. Hassan. I've got a couple of students with me as well. Is that okay?
Yeah, that's fine.
Right, okay. What can I do for you today?
I keep collapsing.
All right, okay.
I think it's my cartilage what keeps tearing.
Okay.
I've been down to physio for the last 3 weeks and it's not doing out. Last week, I was in that much pain, I couldn't go to work.
So all in all, how long has it been going on for?
3 or 4 months.
3, 4 months. So you were fine before that?
I was just fine and just all of a sudden I can just walk down the road and I'll just collapse and just my knees will just give way.
What do you do?
I'm a chef at a hotel.
So how are you managing with your work?
I just have to hop around and hope for the best.
Are you taking anything for the pain at all?
All I've been doing is taking paracetamols.
Can I ask you to come over here?
Yep.
You're going to have to lower your trousers for me to have... Are you wearing boxers and things, yeah? Let me just... Are they okay to join in?
Yeah, that's what they're here for.
Yeah.
No good hiding behind the curtain if they're not going to learn out.
So if you just lay down for me, just relax back. Okay. So whereabout does it hurt? Does it hurt on the front or on the sides?
Sometimes it's this side and sometimes it's there.
Okay.
And I get a shooting pain.
That's painful.
Yeah. Whoa.
It's painful at the back as well?
Yeah, that is. Okay. So is that.
Oh, I'm sorry. I'm sorry.
One of the things I love about being a GP is it's so unpredictable.
You never know what's going to come through your door.
I was asking a patient about whether or not he smoked. He said, oh, on a good day, love, I'd have 40, 50 cigarettes. And on a bad day, thinking, oh, it must be 100. And he went, oh, no, on a bad day, love, I'll only manage 20.
A man came in who had a really big sebaceous cyst or a big skin tag. It was rather large. He then decided he was going to keep this skin growth because he'd named it Paul and he wasn't quite ready to let go. He ran out of the clinic, basically, and we never saw him again.
I used to work overseas, and as part of that, I was learning the language. I thought I was asking the patient, is your poo slippy, runny? But what I'd actually said was, is your poo tasting sweet? And everybody fell around laughing.
I once had a consultation with a lady who came to ask me to amend a sick note because she wasn't happy with what the short, bald doctor had written on the sick note. And I let her ramble on, then I said to her, "You do realise that short, bald doctor is my husband?"
So I was once fertling around in some chap's groin looking for a hernia. And part of the examination is you ask the patient to cough. I normally say, "Give me a cough," but instead I said, "Give me a kiss." And his face was a picture.
There we are.
Hello, ladies.
Hello.
How you doing? All right, Syra. Look at you, all big now. How you doing, Tatham?
Okay.
Come and sit down. How was your scan?
Scan was okay.
Yeah. Boy or girl?
Don't know yet.
Do you know? No.
My instincts are, this is going to be a boy.
I have a feeling you're having a boy as
Do you know
well.
what? Everything's totally different.
Yeah.
Everything is different.
Yeah.
Let me tell you on my birthday.
When was your birthday?
16th of September. Oh my God. I'm 9 now.
Congratulations.
What did you get?
I got makeup, I got nail polish, I got an
Makeup
iPad.
and nail polish.
Ooh.
Malika, can we have a little talk about things?
Yeah.
Is that okay? Your mummy went to see Dr. Knight, who's your heart specialist as well. Were you there?
Yeah.
Yeah, can you remember what he said?
No.
No. Should we just have a little talk about that?
Okay.
Is that all right? So sometimes when your heart is poorly, it means the lungs have to work harder to get all that oxygen going round your blood, which is why sometimes you go a little bit blue and your oxygen levels drop. And some people thought it was because you weren't getting enough air through your throat, and some people thought because your heart was poorly and it wasn't working. And we all now agree it's not because of up here, it's more because of your heart and the poorliness in your heart. We were hoping that when you get a bit older, then we're going to do an operation on your heart. But because your heart has made your lungs poorly, we now have to wait a bit longer until your lungs get better, and then we can do that operation on your heart. So we might be waiting a few years before we can do it.
So we have to wait a few years until my lungs get better. They're going to do an operation on me, then my heart gets better, and I'm like everybody else.
Well, you're already like everyone else.
I'm not.
You are. You're supposed to be.
I always in hospital with Mummy, and nobody else gets to spend time with Mummy. It's just not fair.
I know, but you get lots of other nice things as well, don't you? And we're all looking after you, as you know. How do you feel about that?
I don't know. That was so much.
It's a bit complicated, isn't it? Even for us, it's hard.
Yeah.
So for you, it must be really hard. But all you need to know is that we're hoping to get things better sooner, but we're just going to wait. So it doesn't mean you're going to be more poorly. It just means you're going to be waiting longer for that heart operation that we were all hoping for. So why don't I arrange to see you again in a couple of weeks after you have some time to think about it?
Yeah, no, that's lovely. Thank you so much.
That's it. Shall I try and get you in before the end of this week?
Yeah, please.
I'll sort it out.
No, that's fine. Thank you
All
so
right.
much. Thank you.
Take care, darling.
Right, thank you
All
very
right,
much.
thanks. Bye-bye.
Bye.
Just press that button there on the left.
Oh, yeah, we've got...
And then you go out that way.
What is wrong with Malika's heart?
So she was born with everything the wrong way round,
Right.
which often isn't a problem, but she also had lots of narrowings in her major blood vessels and 2 big holes in her heart as well.
Wow.
So everything was going round the wrong way. So low oxygen levels, heart murmurs, going blue. And so she's waiting for this Fontaine procedure. They've written in the notes that they're going to keep an eye on her lungs and wait for her pressures to come down.
Yeah.
So,
It must be so hard.
I know.
Poor little love.
Come in. Any problems I need to know about?
I don't think so. I did have some fluoxetine a while back.
So stopped how long ago?
About 3 months.
And you're okay?
Well, I was taking it because I don't want to go on to HRT. And I found that I was having some menopausal rages, particularly with drivers. And it was impinging upon life. And it helped, it really did help. But then I thought, do you know what, I've got to get a grip. I've got to, try and conquer these
Because
feelings.
they do tend to try that first now, don't they?
They do, yeah.
I tried it.
It was really surprising, you know, and gosh, it worked. It was great.
And it didn't do for me.
But I thought, well, you know, now I actually know what it is, I can deal with it a bit better. Instead of having the stress and the pressure and then thinking, I'm losing my mind, yeah, it worked. So I thought, well, now's the time to try and wean myself off it. So I didn't stop straight away.
Yeah. I think you can go somewhere like Menopause Matters. I tried it, I tried without it, I tried with it. It's so much better with it.
Is it so?
I'm just going to move this knee for you. Just relax again. Does that hurt?
Yeah.
On the inside? Okay. Now just keep it there for me. Right. That's fine. Come back. Okay. Good stuff. I'm thinking, you know, after examining you, it's painful in literally every direction,
Yeah.
every movement, but you're not able to move it completely.
No.
I think we're gonna have to get you seen by one of the specialists who
Right.
deal with kind of knee problem. They're called MSK people.
Yeah.
Okay, so I'll send them the letter. I'll do a prescription for you for some gel.
Yeah.
Okay, you can rub it 3-4 times a day.
Right.
And that seems to work really well, especially for knee joints and for
Yeah.
hands. Okay.
When I worked, they
Yeah.
asked me if I could get a sick note for last week because I took all week off because I was in that bad a pain.
Right.
I end up crying with it. It's not like
Oh, gosh.
me to have tears in my eyes.
Right. No problems. So that is your sick note.
Take that working tonight.
Okay. And let's take it from there. Okay.
Okay. Thanks
Good
very much.
stuff.
Thank you. Hopefully
you.
we get something done.
All right.
Right. Thanks a lot. Yeah,
Bye.
Have a good day. Try not to work too hard, girls. See you later.
Mum, we'll do your weight. Okay, 83 is 13.1. So this is where you are. Okay, BMI 35. So any reduction is going to be good.
Well, on the plus side, I am going to the gym.
Very good.
Which is very recent. But on the poor side, really, it's just piled on. And I've gone bigger apple. I'm kind of, you know, super-size apple now. So what can I do to get my cholesterol down, then?
We reckon reducing saturated fat, so anything that's solid at room temperature, your butter, your lard, your cheese, things made with that, so pies and pastry. If you like cheese, I'd normally say go for a really strong cheddar and grate it. So you're getting the taste, but you're not getting as much. So we probably just need to see you every year around about your birthday. So just before your birthday, think it's MOT time. All right?
OK,
So this time next year, you're doing OK.
But I might be thinner then. I shall see you when I see you.
Okey-doke.
OK, I'll take this with me.
Yes, so we'll see you October.
October. Cheers.
See you later. Bye.
If I could describe working at the Ridge in one word, it would be...
Fulfilling.
Immense.
I want to say...
Interesting. Working at the Ridge is like one big adventure. Lovely.
In a word, I think it would be perfect.
Can be frantic.
Stimulating.
Loud. It's always loud.
Busy. There's never a dull moment.
Life-changing. But that's two. Sorry.
Could never describe working at the Ridge in one word, I don't think.
No, that's probably the best answer, yeah. Which medical practice have you speaking?
There's a direct quote. You said, I feel alive again.
And I still do because I'm not drugged up to eyeballs.
It's hurt all the time, you see.
Does something like this happen before?
No.
Sharp scratch, sorry. Tell you what, Nathan, I've had bigger boys cry when I do this.
You don't like doctors, you don't like to wait.
It's easier to get into heaven than getting to see a doctor.
I've got to
enjoy life.
Enjoy life and don't let this hold you back.
No.
Come in. Hello, is it Victor?
Yes.
Hi, Victor. Come in. You're looking very smart.
Thank you.
Is that for my benefit?
Oh, yeah.
Go and sit down. Right, how can I help?
Well, yesterday I was going down to pick up my little brother from school, and when I was walking down, I started feeling a sharp pain, lower right side of my abdomen.
Okay.
So every time I put weight on my right leg, the pain started coming more and more.
Sure. Okay.
For the first time I didn't go to football, which is...
Okay. So that's a big deal, is it?
It is, yeah.
Fair enough, yeah. And is the pain there now as well? Okay. And how would you describe the pain?
Kind of piercing towards, like, some of my bones, I'd say.
Yeah?
Yeah, just the top there, just at the front.
Any nausea, vomiting?
No.
No? Going to the toilet okay?
Going to the toilet a lot.
A lot,
Yeah.
okay. Do we have a feel of your tummy? Do you want to just come up on the couch for us?
Yeah.
Are you worried it might be anything in particular?
My mum said that it could be something with the appendix. I just thought it was a bladder.
Yeah, yeah.
So...
Well, it's around the same place as your appendix, so it's something we need to rule in or out, really. So, and just relax, head back, nice and relaxed. If you just point to where you're getting the pain.
It's right there.
Around there. I'm just going to start on this side.
Yeah.
Is that sore?
Yeah, there.
About there. Okay, that is sore, isn't it? Okay. I'm just going to check your pulse. And if you had to describe the pain, kind of 1 to 10, where 10 is the worst pain you've ever had, what would you say?
It's probably like an 8, but...
8, okay. I'm just going to have a listen into your bowels as well. That all sounds fine. Do you think you'd be able to give me a water sample?
Water, yeah?
Yeah?
Yeah,
Come on then.
Take a seat, my love. Who's this lovely lady? My mum. Right, what can I do for you today?
My throat is really sore and hurting.
She gets sore throats all the time. I just don't bring her every time because, you know...
I've had a look and see about a tonsil, you know, when we've seen her with it. Are you ready? Temperature first. Has she had a fever?
No, not that. No. She's only been like it since weekend.
Right.
She came home from Dad's at weekend and said, "Do you know, my throat's really hurting."
Are you good at opening your mouth really wide?
No.
Have you got a cough or anything?
I have it
On a night, I've heard a coughing, yeah.
Open wide. Big R. This torch is brilliant.
Put your tongue down.
Bigger than that. Come on.
Do it.
Ah.
Open your mouth, Claw.
Good lass. Right, so looking at her, temperature's fine. Her tonsils are very, very big tonsils, but there is no tonsillitis at the moment. OK, so I've looked at her record and she had a nasty tonsillitis in July. She was poorly once.
Yeah.
This, I don't think, is a bacterial infection. I think it's a viral infection. It goes with a runny nose and a bit of a cough. When you get to about 12, 13, your tonsils often start to shrivel down.
Right.
A lot of adults don't have any. We look in the throat and we don't see any tonsils, and they've never had the tonsils out. They just go.
Yeah.
So I think we can plod on at the moment. Plenty to drink. Paracetamol. You know, if she gets hot and poorly, or you'll know, because I know you're a sensible mum. She's sensible, isn't she, Mum? Most of the time, eh?
Yeah.
So you know where we are if you need us. Keep plodding on. Get a bottle of water.
That's what I told you, just keep hydrated.
You young ones, teenagers, they don't drink, do they? No. You need to be drinking constantly. Drink now while you can. Me and your mother will be running to the toilet every 5 minutes when we drink a lot.
Definitely.
All right, my love.
All
Is
right,
that okay?
Yeah, thank
See
you very much.
later.
Thanks.
Bye-bye.
Bye-bye.
Any joy?
Yeah.
Perfect. Oh, plenty. Right, come and sit down. I've seen in your records you're from Malawi, is that right?
Yes.
Yeah, how old were you when you moved?
I was 5.
Were you? I did some work in Malawi, actually, in Blantyre. I did some voluntary work in a hospital over there for 6 months.
Do you remember the name of the hospital?
I want to say Queen Victoria or something.
That's where I was born, I
Was
believe.
it?
Yeah.
Yeah?
I believe that's where I was born.
There you go. The urine is absolutely clear, but that rules out a urinary tract infection, but it doesn't rule out appendicitis. The only real way to find out is to send you into hospital for them to do some blood tests and a potential scan and keep an eye on you. I'm going to give the hospital a call. I'll tell you exactly where to go. It'll be the Bradford Royal Infirmary. Do you know where that is? Yeah. Okay. Hi, can I make a surgical admission, please?
Did you always want to be a GP?
No, not really. When I was younger, I wanted to be a vet. I don't really know what happened. I applied to do medicine instead. I think my mum was a deciding factor in that. And then I thought about doing paediatrics for a long time. In fact, when I was in Malawi, I was working in paediatrics, which I really enjoyed, but then I missed adults and conversations with adults and that kind of thing. And with general practice, you get the best of both worlds. You see children, you see adults, you see a bit of everything. Hi, thanks for taking my call. My name's Amir. I'm a GP calling from the Ridge Medical Practice. Hi, I was wondering whether you might be able to take a look at an 18-year-old chap for me who I think might have appendicitis. Started yesterday, gradually got worse. Describes it as 7 out of 10 in severity. Otherwise fit and well, yeah, hardly ever comes in. Thank you so much for that. I appreciate it. Cheers. Bye-bye. Yeah, they're happy to see you up there. I'll just give you this to take. I would go home, tell your mum, pack an overnight bag in case, and then go to Ward 20 at the hospital. There you go, Victor. Best of luck, mate.
Thank you.
All right, thanks for coming in. Cheers. Don't forget your jacket. Nothing to eat or drink until you've seen them.
All right, that's fine.
All right, OK. Cheers. Take care, mate. Bye.
See you.
So what's happened today? School's rang me up about 1:30 saying she's had an allergic reaction to something, but we don't know what.
OK. And she's allergic to nuts, isn't it?
We know she's allergic to nuts. Then they've given her erythrodine. They said she had problems with the breathing. She got wheezy.
OK.
But she's quite blotchy around her face.
Itching as well. Do you remember what you've eaten? No.
What she has said is there was children having chocolates on the carpet.
OK, so...
That's the only thing I can think about.
Let's have a look at you. When did you pick her up?
I've just picked her up about 15 minutes ago, but she is getting more blotchy.
Since then and now, do you think that this is a bit more different in what she has been, right?
Yeah.
OK, let's have a listen to your chest. Can you stand up for me? Can you lift her top up, Mum?
Yeah.
OK, have a seat. Her skin is red, her cheeks do look red. In case, like, you know, it became a full anaphylactic reaction, we're going to call the paramedics like a 999.
Anyone else waiting to make an appointment?
Peekaboo. Ready?
Ready?
Oh dear, that were a big sigh, weren't it? Can you say a big R for me?
Say ah.
Stick your tongue out. Thank you. Thank you.
Listen at your chest.
That's big.
That's because I've got a big head. OK.
Is it ticklish?
Ticklish, aren't they?
Oh, hiding.
Where are you hiding, Hailey?
Come on, are we going? This doctor's got more patients
Hello.
to see. Come on, I know you're special, but you're not that special.
You having a relax?
Bye, everybody.
Bye-bye. See you later.
All right, thank you.
Cheers.
Bye-bye. Come in. Hiya there, come in.
Hiya, thank you.
Oh, is this little Louise?
Yeah.
Come in. I've got 2 students with me as well, if that's all right today.
Yeah, that's fine.
Thank you. How can we help?
Well, I came on Monday about downstairs because she's very sore and it's just got worse. It's spread around her bum.
Oh, poor love. Is she sore?
Yeah.
So this problem with the nappy rash has been going on for how long now?
About a week now.
Right. Could I have a look, do you think? Maybe if we take her coat off and just have a look. She's all right on your knee, though. I don't want to upset her. You're a good girl, aren't you? I like your shoes.
Very tired, aren't you?
Got a Minnie Mouse on your shoes. They're pretty.
Oh.
So she's in nappies?
Yeah.
Yeah.
I know.
Good girl, I'm going to stay over here. Oh, dear.
All right, darling.
Oh, bless her.
She's really sore, though. I don't know if you can...
Yeah, I can see. She is really sore, isn't she?
And it's like that at the front as well.
Yeah, let's just have a look at the front.
I'm going to put this mask on your face, OK?
Ready? There you are.
Is that OK?
Is that okay?
Yeah.
Yeah.
Pretend we're not looking at you. When was the last flare-up?
It's been a couple of months now. We
Yeah.
don't know what's actually triggered it today.
So, a trip to hospital in an ambulance? Yeah.
Thank you very much for coming.
Thank
Right
you
then,
so
Mrs.
much.
You're welcome. Good luck.
It's nice and steady.
Take this off you once we get outside, yeah?
Once we go outside, OK.
Thank you.
Thank you.
Thank you.
Take care. Hope everything gets...
Thank you very much.
Okay.
Nice and slowly.
Cheers.
Thank you.
Sometimes when mine have been really sore when they were little, I used to use like Dipper-based cream on a cotton wool bud and just use that to wipe, moisturising cream, but to wipe and just clean, you know, and avoid water completely, because water can be an irritant as well sometimes. She didn't look 100% actually, but I suppose if she had a jab...
She's been throwing up all last night.
Yeah, should we check your temperature, little lady? Should we check Mummy's first? Let's put this in Mummy's ear. Are you ready? Wait for the beep. Are you ready? Beep. Did you hear that? Look, Mummy's okay. Should we check?
Mummy's not got a temperature, do
Should we get Mummy to do it?
Mummy, do it, look.
If you just press the button down on the top.
Come here. Just let me get your ear.
Good girl. Good girl. Perfect, thank you. There, that's okay. Get that nappy off when you're at home. Fresh air's the best thing sometimes, just to help heal. Right, Dipper base.
What's up, baby? Are we going to go buy some puppy food?
Oh, have you got a puppy?
Yeah, we just got one yesterday, didn't we, for yours and your sister's
You got a
birthday?
doggy? You're mad. So how many? So what have you got them? A puppy?
It's a
Oh,
staff.
just one?
Yeah, just one. It's a staff.
My husband wouldn't let me have another kid, so he settled on a dog, and I am sure another child would have been so much easier than a dog. So you're going to be running after Piddle from the little one with a nappy off, and you're going to be chasing the dog round. I can picture it now.
And then I've got a 2-year-old.
Running through it all. There you go. See how you get on, and if she's not getting any better, bring her back.
Come on then, shall we go then? Yeah. Do you want to go get some din-din? Stop picking your nose. Well.
Take
See you
care.
later.
Bye-bye.
Thank you. Come on then.
Hiya. Yeah.
You just love to keep women waiting, don't you?
Well, that's my wife. I stood her up on our first date.
Well, do you know, nothing surprises me with you.
Look at her now. She still loves me.
Is it... I was thinking your wife's the Dr Amy?
Dr Amy, yeah.
We met at Leeds University, didn't we, back in 1999, Freshers' Week.
Yep. Random pull in Majestic's nightclub.
And we got married in 4th year at medical school.
We've got 3 children, and we've worked together for about 8 or 9 years.
Do you know, I was shocked, actually. And I said to Neil, I went, I could have imagined him with, like, dolly birds.
She's a dolly bird. She's gorgeous.
Yes, but she's an intellectual dolly bird.
She's gorgeous.
Quite a lot of the patients like the fact that they know us as a couple. I think it helps them to relate to us as individuals.
That definitely helps, yeah. And
we get lots of questions about how are the kids and the dog and...
yeah. And you can share your own stories and people relate to you as a family and a couple, and I think you can...
Makes you feel more human rather than a doctor.
Absolutely. Right then, down to business.
Yeah, I'm glad I've got to see you, really, because I saw you in January, didn't I? And we left it where I was going for the injection down my leg, which I had.
Did you?
Yes.
Yeah.
And it's been amazing. But things have deteriorated since I saw you. It started a couple of months after I'd seen you because we were doing
Well, I'm
pretty
just reading through what I'd written, and there's a direct quote. You said, "I feel alive again."
And I still do, because I'm not drugged up to eyeballs and I haven't gone back on the medication, no matter how.
So it was right
bad
to
it's
dig
been.
meals in one time.
Shall we give him that one, love?
Yeah, I'll take that one.
Right then, what's been going on?
What's happening is I've got earache.
Yeah.
And I'm telling my teacher at school it's hurting, so that what they've done is put a hot compress on me.
Okay.
But it was still hurting.
What's he had for the pain so far?
Calpol.
Does that help a little bit? A little bit. And tell me about this, you've just been sick as well?
I was just thrown up everywhere out in waiting
Were you
room.
sick before this or not?
No.
It's just the first time. Okay, so your ear was just hurting at school. It was all right when you went to school this morning, was it?
Yeah.
Yeah. Okay. Right, let's check your temperature and then we'll have a good look, see what's going on. It's your left ear that hurts, is it?
Yeah.
Okay, well, let's pop this in this ear then.
Yeah, Jaden.
Anyone else been unwell in the family or just you?
Just me.
Just you. Okay. Right, let's have a look in your throat and then we'll look in your ears, okay? Just go, ah. Oh, well done. You're very good at that. Okay, so your throat's fine. It's not that. I'm going to look in your good ear first, the one that doesn't hurt, and then we'll look in the one that does, all right?
What? No, you can't have no more. Look at it, Jaden's getting his ears done.
Look at that. Yeah. Yeah.
Do you mind standing up for me to look in the other one? It'll just be a bit easier. Good lad. Oh, yeah. Oh. Okay, have yourself a seat. He has got an ear infection, okay? The right ear looks completely fine, but the left ear's really red and looks really angry in there, okay?
Right, okay.
So the current guidelines are that you give really good, regular pain relief for the first couple of days.
Right.
Because it's causing him such a lot of pain, I can also give what's called a delayed prescription. So I give you a prescription today for some amoxicillin.
Right.
And if that pain relief that you're going to do isn't settling things down, or if he gets any discharge from that ear, then you start the antibiotics. Does that sound
Right,
okay?
yeah, that's
Is that
perfect.
all right? We try to avoid antibiotics wherever possible because most infections are viruses anyway,
Right.
and then you don't want to take antibiotics for a viral infection because it won't do any help, and it can cause other problems as well as antibiotic resistance in the longer term.
That's absolutely fine. Have your sick ball, darling.
All right then. Okay.
Thank you.
All right then. Okay, you're welcome. Get well soon then.
Thank you.
Bye.
Bye. Come on, Jesse Joe. Thank you.
All right, bye.
It's not extreme agony where how it feels, the only way I can describe it is, you know when you've been kicked and you've got the worst bruising ever?
Yeah.
That is how it feels.
Right.
And even when I just bend slightly, I feel as if my skin's been stretched.
Yeah.
And it's awful.
We do see that. It's called allodynia, and it's where you almost feel pain from things that would not ordinarily give you pain. Bed sheets rubbing over something, like loads of things that's nervous system related. We don't. You change your position.
Yeah.
Do you want to perch on here?
No, I'm all right. I'm going to stand.
There's often not an easy solution to it other than all the other ways that we try to manage your chronic pain. You still, even though you feel that things are worse since I last saw you, you're still a damn sight better than when I
Because
first
I'm
met
not
you.
drugged up to eyeballs.
Yeah,
That's
yeah.
why, Doc.
Yeah.
You love that, don't you?
I do, yeah. Some painkillers for long-term pain can actually be quite unhelpful. In short term, they're effective, but in long-term use, we find that, firstly, you can develop quite nasty side effects. Secondly, we find that the painkillers become less effective over time. And thirdly, and importantly, the longer you use some of these painkillers, they actually have an effect where they help you to feel pain more rather than take the pain away. OK, so I think we know where we're at, and we've started some of the really important stuff, which is to reduce some of those drugs and make you feel human again. Would it be sensible to see me when you're at the point that I might have a go at some of the other drugs?
Just because you'll miss me, won't you, if I'm gone? 'Cause I am your shining star.
Well, there is a bit of that as well. Right, so when you're ready, come and see me.
Brilliant.
All right, anything else?
No, that's fine.
All right, good.
Thank you.
Bye.
See ya. Might as well go that way, haven't we?
I feel like,
Hello. Are you a film star?
Am I a film star?
Of course she is, can't you tell?
Yes. She's so beautiful.
Oh, thank you. Oh, thank you. How can I help?
Right, what can I do for you today?
I've been coming to this surgery over 55 years. I went to the optician. They gave me eye drops because my eye are scratched. Now they have stopped the eye drop.
Who have?
The doctors have.
Is it one of the GPs or one of the doctors at the hospital?
The GP.
Oh, right, okay.
GP has stopped it.
Right.
Oh, if I was to buy them, it'd cost over £11.
I see.
I'm a pensioner. And I'm nearly 80 years of age. I'm lost for words. If I was to go blind, it'd cost a lot more.
Morning, my dear.
Hi.
You look good for 70 years old.
Are you a granddad or
11 grandkids.
You've got a lot of reasons to look after yourself.
You're only 65.
I know.
You're a young whippersnapper.
I've had 2 new knees, so I did a lot of walking.
And that's why you don't look 80, you look British, you look very good.
What's your date of birth?
2nd of the 2nd, 30. I wish I was as old as you.
I wish I was as old as them, to be fair.
You're not as young as I expected.
You look a lot younger than what your age says.
Forgotten is supposed to be retired. Youth is wasted on the young, isn't it?
Thank you very much, Rosemary.
OK, see you in October.
Will do, love.
If I was to go blind, it'd cost a lot more.
Oh, we don't want you to go blind, do we? When was the last time you used them?
I use them every day.
Right.
I don't like coming to the doctors and wasting their doctor's time over
No.
drops.
If you need to come, you need to come, really.
I don't like coming. That's the thing.
And what's the reason for that? Is it you don't like doctors, that you don't like to wait?
It's easier to get into heaven than getting to see a doctor.
Now, Patrick, it seems like... You're smiling. Right, it seems like you went to see your optician, yes?
Yeah.
And when you were there, your eyes were tested by one of the ophthalmologists. So they were thinking that you might have what we call a glaucoma.
That's right. I
Yes.
remember. Yes.
Now you remember?
Yes, I do.
So it was basically those people who'd stopped it, that said you didn't need the particular ones that you were using at the time.
My eyes get irritated if I stop using them.
Yeah, yeah. But, Patrick, does it affect your ability to see? Does it affect your vision at all?
It does.
Do you think
if
it does?
I don't have the eye drops, yeah.
Right, OK.
I know there's cutbacks. I know that.
Right.
But I only take 3 tablets a day.
OK.
And
Now,
I'm over 55 years coming here.
of course you are. But it's nothing to worry about. Now that you've come here, right? OK, and I see that you still need your drops, so I can restart you in those drops, can't I?
That's marvellous. Put it back on again, please.
Yes. So I'll put that back in your repeat prescription.
It's very good of you to see me.
It's all right. How's everything else?
Well, the last time I was here, I had blood pressure, which was high. And it's higher today.
Do you think so?
Definitely.
Can I have a quick check?
Yes.
Let's put that on. Let's put that here.
How am I?
Your blood pressure's absolutely fine.
Am I all right?
Yes, you're absolutely
That's
fine.
a miracle.
Hi, Nathan. Come in. Hi,
Hello.
Dr. Khan. Nice to see you. Hello,
Hiya,
Dr.
hiya,
Khan.
hiya,
Nice
nice
to
to
see you. Come
see
and sit down. Great. OK. And you came in just last week, wasn't it? And you saw Dr Caris.
Yes.
And he said you got something called a pyogenic granuloma on your back. Tell me about it. How long have you had it for?
About 2 months now. And I didn't really notice when it started. We were just in bed when it started bleeding.
Do you mind if I have a look at it?
Yeah.
Have you still got that dressing?
Yeah.
We can take that off. Right, sorry. It's not very nice taking stickers off. Oh, yeah, OK, fair enough. It does certainly look like a pyogenic granuloma, yeah. Do you know what that means? Take a seat.
It's known for bleeding regularly.
Yeah.
It's traumatic skin into that cat over here or something.
That's right, yeah. So it's usually caused by a nick in the skin or something like that, and then it doesn't heal properly and it forms this over the top of it. It should come off quite nicely. Good. Yeah. Usually they're on a little stalk and we take them off right from the root. The only bit you will feel, Nathan, is me putting in the numbing medication, the anaesthetic, and that's a little needle underneath it. It'll sting a little bit as the medicine goes in. After that, you won't feel anything at all.
You're not bothered, are you? Just want it after.
You want it off? Fair play. Right, OK, so we probably need that shirt off. Is that all right with you? Yeah? Whitney, will you help Nathan just onto the bed? Are you OK to watch, Mum? You're a nurse, aren't you?
Yeah. I'm not a nurse, I'm a technician, but yeah, I'm all right. Yeah, I'm brave.
There you go. So just like to lie down on your front on here.
Be brave, Nath.
Are you nervous, Nathan? No, good lad.
Will you send it away then?
We send everything, yeah. Normally within 4 weeks you'll get a letter saying it's what we think it is. It's very occasionally it turns out to be something that we weren't expecting, but they tell us that pretty quickly. So, right, so I'm just going to give it a good clean, Nathan. It'll just feel a bit cold and wet. Do you like school then, Nathan?
It's all right.
It's all right, yeah. OK, so we're going to put a bit of the medicine in now. This is the worst bit. After this, nothing at all. Sharp scratch, sorry. Good lad. Didn't even flinch.
You okay?
Yeah.
Tell you what, Nathan, I've had bigger boys cry when I do this. So you're doing well.
Right, Patrick, how can I help?
Both my hands are slightly swollen.
Okay.
Both my ankles are swollen as well. Feet is swollen.
So tell me how it started. What happened?
It just came on one day. My knuckles were a bit sore and no bruising came up. But then it started swelling.
Okay.
And it's hurt all the time, you see.
Right.
And I'm thinking whether it's arthritis, because my runs in my family.
Okay. So something like this happened before?
No.
Never?
No, I suffer from gout.
Yeah.
But not on my knuckles like this, not for this long time.
And this time it's both hands as well?
Yeah.
Because gout tends to usually involve one joint.
That's it, yeah.
One side.
She wants a right puffy and I can't grip.
Yeah, okay.
You can't squeeze anything, you know.
Okay. Yeah, are both hands same or one better than the other? Okay.
Same,
right.
yeah.
And you mentioned arthritis runs in your family. Do you know what sort of arthritis is it, or...?
Osteoarthritis.
Osteoarthritis.
Grandmother, she had all fingers all...
Okay. Let's have a look then.
Those two are the most sensitive ones.
These two, yeah. I can see a bit of swelling there as well, isn't it?
And in my knuckles as well, you know.
So...
That's sensitive there.
This one is sore. Okay.
And that one there, yeah.
That one there as well. Okay, let's have a look at this one. And the problem with your ankle, it started at the same time as well?
Yeah, it started swelling. In fact, it was worse than that, slightly going down.
Okay, can I check your blood pressure as well? Have a quick listen to your heart and your lungs. Just gonna have a listen from the back. Just breathe in and out for me. And again. Okay, thank you. Right, so looking at your hands and joints, obviously, I mean, we know they're swollen and they are sore, okay? I mean, we've talked about osteoarthritis, which is more wear and tear. But with this kind of presentation, what we worry about is a different type of arthritis.
Right.
Okay? Something like rheumatoid arthritis. Have you heard of that?
Yes, I did,
Okay.
yeah.
And that is kind of arthritis where your own body kind of starts attacking your joints and things. And usually it happens in the small joint of your hands. Okay? So I'll give you some medications to help with the pain and swelling. Okay? And we'll arrange for some urgent blood tests. Okay? And then we'll see you back with the results of the blood test.
Okay,
Does that sound okay?
Yeah,
right?
fine.
No
Yeah.
worries. I'm going to give you a short course of naproxen. You take 1 3 times a day for 2 weeks, okay? There you
Thank
go.
you.
All right, thank you very much. Take care.
Bye-bye.
Bye.
Good afternoon, the Ridge Medical Practice, Veronica speaking. Hello, can I help? Hello?
We're supposed to be going out on Saturday, this Saturday. We're doing like a brunch thing where you pay 25 quid and you get brunch and you get unlimited Prosecco for about an hour and a half.
Shut up. Anybody home?
And mojitos.
Mojitos? Oh, I've heard rumours about them. They're supposed to be nice.
Oh, she's gone.
So we expect it to bleed a little bit as I take it off. That's not unusual.
What are you doing this weekend?
Playing football.
Hi.
Do you play for a team?
Yeah, I play for Westwood.
Oh, okay.
And I just started training for Bradford.
Have you? Yeah. That's pretty good, isn't it? It's got a really loyal fan base, hasn't it, Bradford City?
Yeah, because they're not doing very well at the minute either.
No. It's up and down with them, isn't it? That's the thing. My sister is the Bradford City doctor. Yeah. So she might see you. Well, hopefully not. Right, should we put that in the pot?
Yeah.
It's off.
Gosh.
You all right, Mum?
Yeah, I'm fine. Yeah.
We're nearly finished now. They go pretty quick, don't they, Nathan, these things? Right, should we have an absorbent dressing, similar to the one that he had on before? Yeah, that's fine. It's come off beautifully.
Good.
There'll be a little black mark where it's been. It'll scab over, fall off a couple of weeks, and he should have a nice, healthy kind of... Might have a little white patch, but nothing more than that. Looks
So do
good.
I need to keep it covered then now? Or not?
Keep it dry for 48 hours,
Yeah.
and then you can take that dressing off in a couple of days, and it should be fine.
Fab.
Cheers, Nathan. Well done, mate.
Thank you.
How can I help?
Since, well, Saturday when I woke up, I felt like I got hit in the head by something. I'm very disorientated.
Yeah.
My throat glands over here, they're all swollen.
Yeah.
When I wake up, it's like I'm severely dehydrated.
Mhm.
My tongue's just like sandpaper, literally. I don't know if you can see my fingers as well. My fingers became like that. And then this finger, all the pus has come out of it today because I bent it, but I can't bend it. Now I'm all right because I've been taking paracetamols and ibuprofen, but I've been waking up every 3-4 hours at night because I need to take stuff because my back, my waist, my legs, even last night, I rang my brother, he was only in the next room. I woke him up and I said, please just go downstairs, I can't even get up. I need painkillers.
Yeah.
I've not been able to go work for the past, this is the 3rd day I've been off now as well.
Okay.
I've got a picture actually of my hands as well. You'll be able to see yesterday.
Is your throat still really sore?
Yeah. I don't normally take pictures, but
Okay.
you can
yeah.
see.
So were a few like that with that sort of pustule?
Yeah.
Like that, just appeared. Okay. Do you work with any chemicals or anything like that? What do you do?
I'm in IT.
Okay.
I work for an agricultural company, so they do develop chemicals and stuff.
Right.
I don't know if
You don't get involved with touching chemicals.
I
though,
don't get involved with touching the chemicals, but I am in the plants and the labs.
Okay.
And then on Friday I was in a few labs. I don't know if it's something I may have breathed in.
I spoke to 111 and they told me I have to come in straight away. And what are the symptoms? Oh, I've got a very, very sore throat.
So I notice I feel maybe a little bit feverish.
Chesty. Do you actually coughing up?
If you just take a gulp for me.
I feel like my throat is swollen, not sore.
Stick your tongue out and say ah. Ah. Say ah. Yeah.
Cough,
cough. I feel my throat all sore.
Anything else with it, or just the sore throat?
A cold?
Yeah. You've got a bit of a blocked nose, I can hear it, yeah.
When I kind of blow my nose, there's a kind of a funny feeling in my ear.
It's so painful that I can't even, like, touch it.
It's constant.
Every time I swallow, I get, like, the headache.
What we're going to do, were you, eh?
That's fine. All right. Nice. I'll keep an eye on you, honestly, until we sort you out. Thank you. All right.
Appreciate it.
Oh, yeah. It's red, isn't it? Yeah, that looks pretty sore. I'm just going to relax and say, ah. There's some white spots going on back there, too. OK, and you said you felt it painful under here. Let me see if there are some glands. OK.
Yeah, right there. I don't know if you could feel it.
Is that painful there? Yeah. I can feel those. They're not huge, but they might be painful. Yeah. And these have all kind of almost gone, as you say, still a little bit under there. You need an antibiotic for the tonsillitis, pharyngitis there, and I'll give you something that will just finish treating what seems to have been an infection with these pustules here, OK? Are you allergic to any medicines that you know of?
Only penicillin, but that's when I was a kid, I don't know.
OK, no, it's all right. What I'm giving you is what people who are allergic to penicillin would have anyway, so that's quite good. So all these other symptoms, like the aching all over, the eyes feeling heavy, feeling hot and cold, leg pain and everything, it's probably all related to the infection that's caused that throat. It looks like what we call a strep throat, streptococcus, that's caused that infection, and that can cause quite nasty infections, sometimes even nausea, vomiting. In terms of work, you know that you can self-certify for up to a week, so just keep in touch with work like you have done, and you probably won't feel quite up to going back for a day or two. Hopefully the antibiotics will work pretty quickly, and when you feel able to go back...
to work,
yeah, OK, good. OK.
OK, that's
all right?
All right, thanks for your time.
OK, then.
See you later.
Bye-bye.
Bye.
How can we help?
I'm having blackouts. It's like I feel really down, and then if I eat something sweet, that's okay. The energy comes back a bit. But some days it's like yesterday, I couldn't even get up.
So just describe to me what happens.
I don't have to be doing anything, and my heart kind of sinks, and then I just completely get a black. If I'm not getting a blackout, I'll definitely need a drink or something, something sweet, and then I'll come back. But then it's like my brains are half as. It just takes time. Or like yesterday, I had a complete blackout.
So you get a sinking feeling in your heart, and then do you feel a bit faint?
Yeah.
Yeah. And does it come on suddenly?
Yeah.
You also said you've been feeling a bit down.
Yeah.
You're feeling fed up, low in mood.
We've had 2 funerals. My both uncles have passed away.
Oh, I'm sorry. Who's at home with you?
My children.
Just your children?
Yeah.
You don't have a partner?
I'm a widow.
Yeah, yeah. Should we check you over?
Yeah.
So?
I went to hospital on Monday and saw Dr Shefta, I think, or Mr Shefta.
For your legs, yeah.
And I'm just freezing. If you feel me, I'm just absolutely from top to... It's just like ice.
Yeah.
And he doesn't think he can do anything for me.
Did he say what he found? Did he say there were abnormal pulses or anything?
No, he said they were all right. I'm sure he did.
Well, it's ruled out one potential cause for it. So the blood flow to your legs, the big blood vessels, the ones that carry the pulse, are OK.
Oh, good.
So that is good news.
Oh, that's brilliant.
It doesn't mean that the tiny, tiny blood vessels that go to your toes and to your fingers, they could still be...
I mean, just feel my hands.
They are cold, aren't they?
My feet are cold.
I remember, yeah.
I'm so fed up.
OK, that's good. So there's no drop in your blood pressure when you stand up? You didn't feel dizzy then when you stood up? No? Good. So with any of these do's, is it usually when you're sitting and watching TV, or have you actually fallen to the floor?
I have never fallen to the floor, to be honest.
I wonder if you're a bit low and fed up in mood and whether or not this is contributing to some of the symptoms you describe. But you also tell me that you crave sugary drinks. Part of that may be because you go in fairly long periods of time not eating very much, yeah? But A few things I'm thinking right now. I think we should check your bloods. I think we should check them for anemia, and I think we should do the diabetes blood test as well, just to make sure that there's nothing medical underlying this. So let's do those blood tests. Let's see you back again with the results. In the meantime, try and get some good sleep, good rest. Try and get some exercise in the day, so fresh air, doing some walking, yeah? But I also want you to think about your diet as well and eating perhaps more regularly. You don't have to eat big meals, but just eat a bit more regularly, OK? OK, there we go. Ask at the front desk if you can have a blood test.
In
okay?
here?
Yeah, and let's see what it shows.
That's fine.
All right, my love.
Thank you.
Take care.
Thanks a lot.
Bye-bye.
Bye.
Amy, I'm going to put something to you, and it doesn't mean we're going to do this, but I just want you to have a think about this. What would happen if we never got to the bottom of all of this stuff? How would you feel?
I want to finish my autobiography.
We're all waiting for that autobiography.
You know, so I've got to... Sometimes I sit and I think to myself, I'm just lazy.
You're not lazy. You've got some symptoms that are very real and are getting you down. Sometimes when we investigate patients with multiple symptoms like this, often they're very real, but we don't know why they're happening. It might be getting to a point where we say, we've investigated it all now and we've seen people, and there are some things that we are doing for the eyes, the joints, but some of the other things may be a case of, right, I know I've got this, I have to learn to manage it. I've got this book to write, and I can't let these things stop me anymore.
No, I'm strong, I can.
You're very strong. You've been through a hell of a lot, Amy, in your life, haven't you? That's why you're writing that book.
I have, love.
Yeah.
I've got to enjoy life.
Enjoy life, and don't let this hold you back.
Now, what do you think, girls?
Doesn't that sound good?
Them.
Yeah. Right, so I'll send you out an appointment to see me in a couple of weeks.
I don't know how this doctor puts up with me.
Oh, no, I like it.
Anyhow, all the best, and bye-bye, love. And it's been a pleasure to see the two of you.
OK, Amy, I'll see you in a couple of weeks.
That me done then?
Yeah, that's you done. Thanks very much.
Thank you.
Ta-da.
Bye-bye.
All right, you take care. All right, bye.
Bye.
Bye-bye, darling. Beautiful.
Thank you.
See ya. Bye-bye, love.